This conference is a really good time to take stock of how far along we've come, to discover some new good practices that will get us close to the ideal that we are striving to, and this is to make sure that the mental health and well-being of young people in Serbia is better than it was before. Thank you very much for being ready to work together with us on this goal. Hopefully today at 5:30, when we leave this wonderful conference room, hopefully we will leave it ready and we will have some questions. We will have many good contacts from other people, other colleagues, and hopefully we will leave more motivated to continue working on this hard work every day, starting from Monday until the next conference and until the next important milestone. It is extremely important for myself personally that young people are here with us today and that we are somehow safer with them. You know, it is important for us to support each other and to be compassionate and dedicated to make this world a better place. Please, Elena. So let's talk about important topics. Let us inspire each other to develop strategies that will allow us to make sure that mental health is recognized and addressed in a timely manner. So I would like to invite you now to look at a short video where my peer, Milica, and her mom are talking about the importance of timely support.
Priča o mentalnom zdravlju nije sramota. Pričajte o sebi, pričajte o onome što vam treba, o onome kako se osjećate, meni je to pomoglo, ja sam sigurna.
This helped me and I'm sure that will help many other people. Milica encountered first mental health problems as a child. When she was 6.5, we divorced, and at that moment she completely changed. I was afraid that I will be abandoned. I wanted to have the love of the closest people to me, my parents, my sister. She started withdrawing. She wasn't so assertive, nothing at all. Teenage days were even harder. My grades were a bit poorer, and all of that took a huge toll on me. I didn't socialize with anybody. Young people often don't know to recognize when to seek help. Every parent should listen to their child, however many children you have. You just need to know this look, this smile, whether the smile is there or not. They're afraid of judgment and discrimination. It's important to take your child close, to have them there so they can feel safe, so that they can, to give them a big hug so they can know that you are their safe haven, that you have protected them. It's very important for young people to have available psychotherapists, workshops, counseling offices. There's probably many children who would go there and open up. I assume that they are troubled by many things. I can see how young people are losing their sense of direction, and I think that the talking about mental health should be raised to a much higher level. UNICEF supported the government of Serbia to ensure available and quality support, to eliminate stigma in society, and to empower young people to take care of their mental health and seek help. Today, I feel great. Today I'm well, and I understand what things are good for me, and I'm trying to take this path. You know, this means my further education, personal development. I have a huge group of friends who are huge support for me. Theater is something that also made me get to know myself. Thank you, Milica. Thank you to Milica and her mom for sharing this very intimate detail from their lives. There's few of us who could stand in front of cameras and speak up and say, yes, I am seeking help, I do need help. And look, I'm not ashamed of saying that, so well done for courage. Now, I would like us to start with the official part of the conference, and I'm extremely grateful that Minister of Health, Mr. Zlatibor Ronjar, is here with us and ready to open the conference. Minister, the floor is yours. Ladies and gentlemen, esteemed colleagues, ministers, directors, esteemed guests, it is my great honor and pleasure to greet you as trustworthy partners on the path that the government of the Republic of Serbia took moving towards the goal of health for everyone. Children and young people are those who will inherit this country. They will be decision makers in the future, and that's why their health and healthy upbringing and growing up is one of our main priorities. The Ministry of Health in the previous years has been investing serious efforts in expanding the network of the services for protection of health of children and young people and expanding the services that will ensure the improvement of health care of these vulnerable groups. The expression of our clear determination to work actively and comprehensively and continuously on this is definitely the call to action of the Ministry of Health to education, social protection, family welfare, youth and tourism, and all other relevant institutions. We don't have any dilemmas that the policy of the government aimed at well-being of children and young people will give the best results precisely through the living and rich intersectoral cooperation. The partnership with UNICEF and the World Health Organization is helping us better listen to the needs of the community and to reach every child, adolescent, and people providing care for them. It is difficult. Growing up is difficult, and the best part of maturing and the most demanding part of a human person is the transition from childhood to being a young adult. Promotion of mental health, prevention, early and timely treatment of mental problems are part of constant activities of the Ministry of Health. And our starting point is a holistic approach that says that there's no health without mental health. That's why I'm glad that we have met today again to take stock of what was done and to plan our future activities. And I'm convinced that every time there will be more and more of us at these meetings to do this important task. And once again, congratulations for organizing this conference, and hopefully we'll have a successful work. Healthy Serbia is our joint goal, and healthy children are our biggest and the most important investment for the future. Thank you.
Thank you, Mr. Loncha. Now I would kindly like to invite Diana Kostadinova, Director of the UNICEF office in Serbia. So please take the floor.
Dobar dan I dobrodošli. Your Excellency.
Good morning and welcome.
Professor Djukic-Dejanovic, Minister Žigmanov, Minister Stamenkovski, dear Fabio, dear Jana, ladies and gentlemen, friends and partners. On behalf of the UNICEF team, I would like to extend a warm welcome for joining the third conference on mental health. Today, we come together with a powerful vision, a world where every child and every young person in Serbia has their mental health prioritized. And being together, we can do it. We can turn it into reality. Milica's story that we just saw is one of the many stories of young people. Her struggles reflect the silent battles young people face every day. And these battles are always hidden. As a parent, I can easily recognize myself in the face of her mother, and I'm sure that most of you can align of what we saw on the screen. And we must not ignore what we cannot see. Our children, our young people, parents, caregivers, and professionals around them, they all need support, and today, more than ever. The mental health of our adolescents and youth is under pressure. Many suffer quietly, unable to share the burden that they are carrying. For every Milica who has the strength and the power to speak up and to seek for support, there are countless number of others who don't have this support. We must be the one to create the safe space for them, a place where they feel heard, valued, and supported. Investing in mental health is essential. It is not optional, because healthy children become thriving adults. contributors, creators, leaders of tomorrow. And every euro we invest in mental health brings back economic benefits a number of times more. Reduced health care costs, less dropouts, lower crime, increased productivity of the society. When we invest in mental health, we are building a resilient society that can face every one challenge after that. And for this, we need to support every one person who is part of the child's life. Because children and young people, they need guidance. Their parents, they need tools how to do this. The teachers, they need trainings. The mental health experts, they need resources. You know this proverb, it takes a village to raise a child, and it takes a whole society to raise a healthy generation. Serbia is leading the way. The Memorandum of Understanding that has been signed between the 6 ministries the previous year, and with the Ministry of Health at the helm, and the establishment of the working group have set a very solid foundation. And our ongoing collaboration with our partners from the World Health Organization further supports these efforts, providing guidance and expertise. And we cannot stop now. So let's today be a turning point, and let's push further to ensure that community mental health services are available for every one child and every young person. More funding, prevention, early intervention, community-based care, these are the steps that will build a truly resilient nation. Youth centers are offering safe space for young people to express themselves and to seek help. And this is a major step forward. But we cannot stop here, because the tragedy of Ribnikar the previous year highlighted the urgent need to support the mental health and the psychological well-being of all the children. And we know that the government could not and should not do this alone. We must act together. The government, schools, communities, families, partners like academia and civil society or organizations, all of us together can create a meaningful impact. And we have a very promising start. We have the commitment of our incredible partners, the embassies of Norway, Australia and Israel, Deleuze, L'Oreal and electric power industry of Serbia. They all work together with UNICEF to improve the mental health services for young people. And these partnerships amplify our reach out to young people. These partnerships make our work possible. Only together we can reach more young people, offer more hope, and create lasting change. The change requires courage. It takes energy, and it takes partnership. And that is what today is all about. So thank you for your commitment, and thank you for being part of this journey together. Hvala puno.
Hvala puno. Thank you very much, Ms. Kontadinova. Now I would like to invite Mr. Fabio Scano, the President of the World Health Organization for Serbia and the Special Convoy of the Regional Director for the Western Balkans. So please take the floor.
Thank you so much. Ministers, Diana, I can't see very well, but it's okay. Everyone in the room and at home, let's take a deep breath and go for a trip back in time to 1948. That is the founding year of the World Health Organization, with a constitution that reads, "Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity." To me, it's shocking how forward-looking these constitutions that were written by my grandparents, our grandparents, I won't check your age, but is over 75 years old, are actual now, nowadays. Why? Because the pen holders of these constitutions were surviving the Second World War. And so they were best placed to understand the impact of crisis on our well-being, but also on the recovery and resilience. 76 years on, not much has moved, I have to say, mostly because of stigma and discrimination. And let's fast forward to these days, and what has happened that made us change our mind and our approach to well-being and mental health. COVID, because it touched every one of us one way or another, not only physically, but for our mental well-being. And of course, all the crises that we are witnessing around the world with so many deaths. And also to mention the events that we had in our own Serbia 1.5 years ago. There is a major political commitment now. This week only, the Prime Minister of France, I'm saying the Prime Minister of France, made mental health a government priority, not a sectorial thing. Here today in Serbia, 4 ministers and 6 ministries are joining forces together with also partners to move this forward. This is a great momentum for advancing our well-being. But how do we do? There is a system approach that we have to follow, but there is also so much that myself, Zlatibor, I bring you in, Diana, and every one of us can do to make a difference. You are much more curious to know what we should do as individuals and what the minister should do as individual, but let's start from the system. We worked with the Ministry of Health mostly, and I'm open to wider collaboration with UNICEF and other partners on focusing on youth. But mental health is not only for youth. Think about the elderly, and ourselves, not only our elderly. To strengthen the capacity of the health system to talk and to recognize mental health conditions in youth and to refer them to other sectors when this is needed. We went for a campaign that is Čuvaj sebe, ne čuva u sebi, that it was very popular, and we will continue to do so. But in the future, we will support the Ministry of Health in improving the quality of services for youth and mental health. I'd like to bring up also a figure that is from the last report of WHO a couple of weeks ago on the impact on the social media and internet on our young generation. In Serbia, 1 out of 11 kids spends more than 7 hours a day on the social media and internet. It's nothing better or worse than other countries. We are all on the same boat. And this touches me personally because I have a 12-year-old and 15-year-old kids. They live in another country. And interesting enough, next Friday with their mother, we are sitting down to talk to them on how their ideas to limit exposure to screen time. I will read the WHO report. I hope to learn something on how to talk to my children about it, and I will tell you how successful it is. But definitely we have to think over and over on how the impact of this new technology is affecting the mental health. So let's get to us as individuals. What can we do to change the future of our children, but also to change how we relate with other people? And it's a simple thing, empathy. We need to do much better and teach our children as parents, but also as teachers, on reaching out, not only to better understand the others, but also to offer help. Not that you have to be the doctor for every of your friends. You have to refer when you understand that is the case. But it's the concept. Think about simple words or simple things that we do every day. How are you? Is this a salutation thing that we do without meaning? Or it is something that is full of empathy and we are really interested in how the other person is and to reach out to them and also to be interested in what their problems could be. That is what we should share with other children. But above all, this is also a very good lesson that we should use for ourselves as adults. Thank you very much. I hope that you will have a great session on mental health, but it always starts from ourselves. So you can talk about so many things, but it's about our approach to mental health, to destigmatize it, and to leave discrimination out when we talk about it as an excellent starting point. Voilà.
Thank you, Mr. Scano. It is my great pleasure to now give the floor to Jana Numanovic, the Young Advocacy for the Youth Board, and my dear friend, to share with us what the topic of mental health represents for her and her peers, what are the barriers that they face with, and what are their proposal vis-a-vis solutions to those challenges. So please, Jana, take the floor. Good morning to everybody. Today, I would like to address you as a young person, talking about something that affects us a lot, about the accessibility to the mental health services. What we notice is that we are not having sufficient services that are tailored to the needs of us, young people. Therefore, many of us feel left behind and unpleasant when we need to talk with the professionals. We observe them. Two former persons, we have the impression that they do not understand how do we feel, and before we seek the assistance, we need to comprehend that we are having the problem, which could be quite challenging due to the social and cultural norms surrounding us. For instance, parents often believe that the problems, mental health problems, would go with the year. Sentences, don't you worry. Well, when we were young, we never talked about this, are actually sending us the message is that it is the best to somehow hide our mental problems. This kind of thinking leads to the fact that a lot of problems remain inadequately treated. Therefore, we need to get the information about the mental health, which is easily understandable and what's the most important, easily accessible. We shouldn't vague and navigate through the abundance of options overwhelming us, but to get the contents tailored to different groups of teenagers, depending on the gender, ethnicity, and the level of stress. We should never forget about the groups that are constantly neglected, groups such as Roma group or children with disability. It is important to get the accessible platform through which we and members of our families can seek support and assistance. Support in the school is the critical, because we know that 50% of the mental problems are expressed before we turn 14. Schools should be the first defense line in recognizing our problem and assist us before it's too late. But the thing is that a lot of young people, particularly boys, do not have any confidence into the services provided to us by our schools. They are intended to mental health, but boys and girls are afraid that they will not help them, and they will not keep privacy of the information. Why? They're afraid, and therefore they're afraid of seeking any help. Then online resources comes into stage. The information available through social networks, web pages, and application could eliminate a lot of barriers we young people face with when seeking in-person support. Online content are accessible, anonymous, which means that we can overbridge stigma. We can additionally ease the process of seeking the help by changing the common forms of behavior. The professional support should become the first choice when we feel bad. This could help to destigmatize seeking assistance and to recognize the problems in the early stages. And to conclude, the social stigma could be a huge barrier. due to which we are afraid that we are going to be rejected. But we can change the narrative. Positive examples, peer support, and referring our peers to professional assistance can contribute significantly to change the perception of assistance seeking. Through the campaign launched at the social network led by youth, cooperation with the TikTok ambassadors for the well-being, or presenting inspiring persons such as young known people or sportsmen, athletes who already seek assistance, we can strengthen our voices. These models could share their pieces of advice and success stories, opening the room to provide support to their peers and changing the way we speak about mental health. Thank you very much.
Well, there's a lot of courage in this room. I'm not sure all of us will be courageous enough or empathic enough, as Dr. Scano suggested. But yes, we are action-oriented. And we have an important guest today that has been motivating us these days and in general to change our actions, to change our perspectives. Those of you who need translation, you can prepare to put your headsets on, because now we will have speech by our dear colleague, Dr. Gabriel Fontana, UNICEF Regional Health Advisor for Europe and Central Asia. Gabriel, please.
Good morning, colleagues, ministers. It's a pleasure to be here and have the opportunity to share with you a few thoughts. 1 year ago, I was here in Belgrade, and I witnessed the beginning of this multisectoral collaboration. An example, really, that Serbia is giving to many other countries that look up to this impressive collaboration of 6 different ministries in support of children and adolescent mental health. And we're here today to take stock of how far we've gone, but also to keep momentum, to keep the effort up, and even to accelerate. We just heard from Zana, and before on the video from Melissa and her mother, how challenging it can be for young people and their families to deal with mental health issues. They face emotional and behavioral challenges, and they don't live in our ministries. They live in their families, in their communities, in their schools. They look for help in the internet, in the media, among their peers. And very often they're concerned about coping with their challenges and how to seek help and how to find help. Now, the problems that we're discussing today about, they're not exclusive to Serbia. These problems, unfortunately, we're seeing them everywhere. Here you can see some data. I will not go in details. That's not the point today. But just let's acknowledge that globally, around 16% of young people have mental health disorders. And that suicides are the second most common cause of death among young people. That means 3 lives every day. There are publications, this is the Lancet, and it indicates from Australia to the UK, Denmark, the US, how mental health conditions are increasing across the board among young people. And I want to make sure we understand the sense of urgency of the situation. It's not only about suicides, that's the tip of the iceberg, and violence that we don't want to see at all. But there is also mental ill health, the anxiety, depression, discomfort, and the promotion of mental well-being that is vital in all our sectors. There are many efforts ongoing. This is the efforts that we see in, at global level, championed by UNICEF, but we also have the Pan-European Mental Health Coalition, championed by WHO. The European Union last year signed a communication on mental health. In European Union language, that's a strategy on mental health. And they started making available resources to countries for mental health for children and adolescents. WHO and UNICEF have a joint program for young people mental health. And in this region, it has been implemented so far in North Macedonia, Albania, and Serbia. So a lot going on, and very significant efforts going on. What is the importance of the multisectoral approach? Is the title of my presentation. I think that in Serbia this is well understood, but let's spend 1 minute to reflect on that. We have evidence that shows that if we want to make a difference for children, one sector alone cannot make it. Health alone, education alone, we cannot make it. I'm just using 2, but it's for all, right? Let me start again putting the child and adolescents at the center, okay? I said they're in schools, they're on social media, they're with their families and communities, with their peers, and they're looking for help, self-help sometimes, a chat sometimes, professional help other times. And there is a lot going on in each one of our sectors. Again, for the sake of time, and because we all know this, I will not go into the details, but I wanted to represent how much is going on in each sector. When we think of health, we think of the mental health specialized care, but we also think of the support, the prevention and promotion that we can do in primary health care. We think of referrals, prevention, the institutionalization and improvement in quality of mental health. When we look at social services, colleagues from social services, you are always in contact with the most vulnerable groups. And those groups, those people, very often face additional challenges in mental health, and they need our support. And so you look at alternative care, you look at the vulnerable groups, the capacity of our social workers, again the referral, it's a lot. When we look at education, children live in schools. The promotion, the support from the teaching staff, the good quality of psychological services offered in schools, those can make a huge difference. You are probably the sector that is most in contact with our children and serve them the closest. We have the Ministry of Youth that is quite active with the youth centers, making sure that when there is a red flag, children and young people are referred, they get the right support, and they promote mental health and well-being. The Ministry of Family. I know that you are working quite a lot now on policies, including on guardianship, on your workforce and their capacity for mental health, working with civil society organizations, supporting families. Ministry of Human and Minority Rights. You are working on legislation and anti-discrimination. There's an important linguistic stigma. I'll touch on that in a second. With vulnerabilities of minorities. And then there is something that cuts across, and I always want to mention that. And I think you just mentioned it before, stigma. Stigma undermines so much of our efforts. There is the fact that young people that face mental health challenges, they self-stigmatize themselves, they judge themselves because of that, because of what they hear in the community, in the media. And very often they hesitate to open themselves to their families, to their teacher, to seek health care. So I think it's a job for all of us to start talking about mental health, mental well-being in a positive way, and mental health in a non-stigmatizing way. That's a mission for all of us. When you put it all together, this is what you see. Okay? A lot of efforts, and it can feel overwhelming. And trust me, I speak with colleagues in the different sectors, and very often the message is there is so much to do, and limited time and resources and capacity to do it all. Okay? So let me show you how it feels. Sometimes we feel that we're good at juggling so many things. That's why I use, if you see, I visualize everything as balls, right? So we feel we're good at juggling balls, and we can keep quite many balls in the air, but all of a sudden it might feel a bit more like this. there are too many balls in the air, and then it can feel like this. We can't really cope with all the needs that are in front of us. Okay? But here today, we have 6 ministries. We are many. We can juggle more balls. You are already there. Congratulations for that. That's already a big step. But now, if we start juggling balls together, we can keep more balls in the air. And when we do it deliberately, we can keep, let's see if you can follow me. Yeah? Sorry. Thank you so much. Our technicians there are very agile. I have to congratulate them. We can also keep bigger balls, bigger difference for children and adolescents up in the air, sustain them. Okay? And how do we do that beyond the metaphor? We have to choose what to juggle. We cannot do everything at the same time, right? We need to have the big picture in mind and be very deliberate in the way we do it. And I have to say that right now, in each sector, you are already doing many things at once. And that's good. Maybe the one ball that we need to put in the air together, as I said, is working around stigma. We need to sustain the good efforts. And I have to say, I spoke with your Minister of Health yesterday. I spoke with some of the colleagues that work in the different ministries. I see some of you here. And I have full confidence that the commitment in Serbia for mental health for children is there, is not fading, if at all is being renewed. I hear that in your agendas. I see that you have joint plans with resources and increasing resources attached to it. So you are serious and you are believable. Now, what do we want to see jointly? And I conclude with this. We want to see less young people facing mental health challenges. And for that, the promotion and prevention that you are doing and you are planning to do will be vital. We want to see more young people that can access timely and good quality mental health care when they need it. To do that, to get there, we want to see your political commitment and leadership. We are seeing it. Keep it up. We want to see effective coordination, because only if we work in a coordinated way, we can have the impact that we need for children. You are doing it. Keep it up. We need to see strong and strategic investments. I see them growing. Accelerate. And we want to see implementation in all sectors that reach children in need. And that's what it's all about today. Let's take stock of what we're doing, and let's do even more. Thank you so much.
Messages. Izvinite, molim vas.
My apologies. It is a great pleasure that we have a colleague, our dear director, Diana Konstantinova, in a role that is similar to mine today. I would like to present the next panel discussion dealing with huge challenges in the improvement of the mental health system, focusing on the strategic level. Now, Ms. Konstantinova would moderate the panel with the perfect panelists, primarily Minister Dr. Slavica Đukić-Dejanović, Ms. Đurđević-Samevski, Mr. Žigmanov, with the director Ivana Stašević-Karličić, Antonijević, with Ms. Stojanović. So please take the floor.
So, dear colleagues, after hearing the regional experts and also after hearing the voices of the young people, now let's turn our look at the decision makers in the room. And today we are joined by an esteemed panel of very strong leaders in this area. Professor Slavica Đukić-Dejanović, Minister Tomislav Žigmanov, the Minister of Human and Minority Rights, Minister Stamenkovski, the Minister of Family Welfare and Demography, Dr. Ivana Stashevich-Karlicic, State Secretary of Health, Mrs. Ivana Antonievich, Assistant Minister of Youth and Tourism, and Mrs. Lajana Markovic-Stojanovic, Acting Assistant Ministry from the Ministry of Social Protection, Labor, Employment, Veterans and Social Affairs. Mental health is important for every one of us. We just exchanged with Professor Đukić-Dejanović about our mental health. But the most important, it is for children. And we've heard the global data and the regional data. Later today we'll hear also some of the national data. But the most important is that we've heard the stories, the real stories of young people. And these voices is crucial to be heard. And I'm sure that our distinguished panelists heard these voices at the previous conference, because the main message of the young people the previous year was, do not leave us for later. So that's why this year we are going to take stock of the discussions, of the solutions and the collaboration that has been already established. As you remember, 1 year ago, the Memorandum of Understanding between the 6 ministers has been officially signed during the conference. And Serbia made significant strides after this Memorandum of Understanding. Now there is an action plan, and almost $1 million public financing has been allocated to ensure the implementation of this action plan. So let's hear from our champions today. At this panel, we are going to discuss what we already have achieved, what are our concerns, and what are the future steps that we are going to take. It's really an ambitious agenda for one panel, so that's why I will ask my respective colleagues to keep for the time limitation of 7 minutes. But first on my list is our dear friend, Professor Slavica Đukić-Dejanović, the current Minister of Education, who is not only Minister of Education, but her heart is in this topic due to her educational background and the passion of her life, the psychiatry. So, Professor Dejanović, looking retrospectively, how do you assess the development and the progress that has been made in this area?
Thank you very much for your question, for introducing me. Thank you very much. It is a huge pleasure for us who have been practitioners in the psychiatric area and in the official politics to discuss the mental health of children and talking about it with 6 ministers. If I were asked, if I were given a power, we would have included the Minister of Finance and Minister for Information and all the others. But at this point of time, it is sufficient to be accompanied by these colleagues, and extremely thanks to UNICEF for the coordination and the idea that only jointly and comprehensively we can approach the mental health of young children. And you've been contributing in this area for many, many years. I'm going to tell you that we are reaching the 10th October, the International Mental Health Day, that we are constantly thinking about mental health of our children. We have sad memories. We are overwhelmed with the scaring memories due to the strategy that affected us in 2 years, and one of them was in the school premises. So in that regards, the Ministry of Education had to not only knock at each and every door, asking everyone to jointly mend and improve the mental status, primarily the knowledge of all participants in the educational process, but unfortunately the perpetrator of that tragedy in the school was a pupil and a young boy. So it was completely clear, starting from the realistic knowledge that the children are spending most of their time in school, that we need to focus on the fact that the teacher, parent, and the child should be equipped with more knowledge. We need to work on their mental literacy through specific extracurricular and curricular activities, and we need to advocate to the level of competences and equip those sending the educational messages to children, meaning professors and teachers in preschool, primary school, and the high school education system. So in that sense, we had the great support, and I would like to use this opportunity to extend the thanks to the Institute of Mental Health in Serbia, so to the Practitioners Association of Psychologists of Serbia. They particularly helped us, and the Association of Pedagogists provided us the assistance, individual, which number we cannot count. So we all together understood how we are overwhelmed with the stigmatization when it comes to mental health, and particularly mental health for children, and how much we need to break those psychological and sociological barriers to reach certain results. What have we done in the educational sector? So I would like to make an overview of what we've done so far, starting from the tragedy onwards, because in addition to the third conference, and I would like to extend the thanks to organizer, we are going to organize the fourth, and maybe then we will have the chance to see the steps that we are making and how closer they are to improve the knowledge about the mental health. So I do believe that it is extremely important that the Ministry of Education, at the point of time when we assessed that the level of the knowledge is intertwined with the shame resulting from something that is living in our collecting being, which is the belief of the ancient people that the mental health are part of the demonic forces and that we need to expel them as the evil goes from our bodies. So those beliefs are still living in the collective beings, and we are all afraid of our own mental problem and the mental illness. And when we feel a kind of a fear, when we see a person with the mental issue, that is our own actually fear, I would use, from getting crazy. Of course that the mental health is not preventing, and the prevention is not actually preventing the mental illness. The people are having the problem of isolation, problem of depression, anxiety, addictiveness. And of course, it was necessary to address primarily to our Institute for the Improvement of Education through a systemic form. We start raising the level of knowledge at school of teachers and students with the Institute of Mental Health and all well-intended individuals who wanted to be involved in raising the level of knowledge in the previous academic year. One of the significant forms of raising the awareness, using them through the assistance of the mentioned institution with the help of UNICEF, was that 2,400 psychologists and pedagogists who are expert in their jobs, but they themselves were not equipped with the sufficient knowledge about the mental health of children. So we've managed to educate them, and we will continue educating them actually how to recognize whether a child has a mental issue. A definition of the fact that a large number of children have potential to cope with life and problems without expressing any risk of mental illness, that a smaller number of children is quite sensitive and they really need the support, advisory work, and the third group of children who are in so-called red zone, where we need to involve our collaborators from the Ministry of Health. In addition to the fact that we continuously educated teachers, we assessed that the crisis, in addition to the fact that we had standards regarding the neglecting violence, thanks to the great cooperation with UNICEF, that we simply need to widen and broaden our knowledge how schools and educational institutions need to act in crisis. And we supplemented those legal enactments and devised the guidelines on social skills and emotional characteristics that we need to monitor, that children, teachers, and parents need to have for the crisis situation, which could be of the social type, which could be a disaster, or any other type of the crisis that could affect us. So in that sense, we sent that manual to 1,800 schools, and our intention is to specify each and every segment of that textbook, that is that manual. Further on, with the UNODC, we assessed that the adolescent age is quite a sensitive period, and that the focus of the family of adolescents who are neglecting mental problems and are observing them as just a transitional stage in upbringing. We need to raise the knowledge of the family. So we've devised the program that's starting being implemented, and we need to intensively work with adolescents. So with the 6th and 7th grade pupils, 10,800 children were educated in understanding and preventing and conserving mental health and recognizing early stages of the illnesses. And after that, we assessed that within the ministry, we need to establish a special sector dedicated solely to the issue of violence, dedicated solely to the sensitive groups, and that would devise special programs. And in the last academic year, we did it. I believe that our cooperation with the public health institution throughout the country, particularly with Batut, was of the very important, because we've been developing the white paper and we would deepen the work in that regards. But I believe really that the most important is that within the government of the Republic of Serbia, representatives of the ministries sitting here and the ministers whose representatives or the ministers are today with us, there's no dilemma how it is important to all of us to deal with the mental health of a child in the idea when parents believe that they should become parents. A child in the stages of pregnancy, it is a child in the psychological sense as of the first cry, and in the preschool institution we are planning to implement preventive programs in a way to expand the level of knowledge of what the mental health is, how to recognize without stigmatizing a child with a mental issue, and how to dedicate and involve that children into the social activities. Thank you very much.
Thank you very much, Professor Đukić Dejanović, for highlighting the role of the school as the heart of the system, because children live in schools, as we've heard from Gabriele. Children live in schools, and it's important to create all the supportive network around the schools. And you also highlighted the professional development of the workforce, which is crucial for adequate interventions. And I take note of what you said about the two missing ministers at this table, the Ministry of Finance and the Ministry of Telecommunication and Information. We'll invite them for the next conference the next year, because we are promising that it will not be the last one, as you said, 4th and maybe 10th conference, but for the next conference we will invite them. Thank you very much. We already heard from the Minister of Health who was in the lead of the preparation of the action plan about the steps that have been taken. But now we have the pleasure to hear from the State Secretary, Dr. Ivana Stashevich-Karlicic. What is the vision and the key steps from the health perspective that should be advanced for mental health and well-being of young people?
Thank you. First of all, I would once again like to greet you on behalf of the Ministry of Health and to express my huge pleasure and gratitude for the partnership in this huge endeavor for caring for the mental health of citizens of the Republic of Serbia. And when we talk about public health, one of the main priorities of the Ministry of Health and the government of the Republic of Serbia is definitely the health of children and young people, because this is the best investment for the future. Children and young people will sooner than we imagine, they will be some important people making important decisions. And we will be in their hands, both. We will be also in a sensitive period of life, the older age. What the Ministry of Health has been doing for years now is not only organizing healthcare services in community. We had a lively public health work that brought some results. From 2017 to 2022, we lowered the suicide rates by 20.1%, and I think that this is the best indicator of everything that we've done about mental health. The holistic approach, no health without mental health, is what is guiding us in providing care for this segment of health of people. When I say people, I'm primarily thinking about children and young people who are to become parents at some point. Today is a good opportunity to take stock of some things that we have done so far, and for all of us together to have this lively intersectoral cooperation and increase future activities, and to make some plans for future activities and be very operational. The Ministry of Health, when it comes to intersectoral cooperation with the Ministry of Education, Ministry of Labor, Employment, Veteran and Social Affairs, Ministry of Family Welfare and Demography, Ministry of Human Minority Rights and Social Dialogue, and the Ministry of Tourism and Youth. So our ministry has signed the Memorandum of Cooperation in the area of prevention and protection of mental health of children, adolescents and young people. Recognizing the priorities and being guided by the priorities of the government of the Republic of Serbia. The memorandum sets ambitious goals which include ensuring continuous support to young people in form of raising awareness and providing counseling services, and also we want to involve institutions from all levels into the efforts to preserve mental health of young people. We would also like, by the end of 2029, we would like to ensure minimum package of services for mental health in all cities and municipalities with more than 15,000 people. Another thing I would like to point out today is that the Ministry of Health, in the new constitution, the government of the Republic of Serbia has been working intensively on strengthening the connections with the local self-government and working to increase the level of connection and solidarity with the healthcare system. In this context, the Ministry of Health is planning to implement the following activities within the action plan for mental health of young people. Number one, I already mentioned it, the minimum package of services for psychosocial support in healthcare institutions and schools by the end of 2025. So the ministry, together with local self-governments and primary healthcare centers, will work on that to implement this memorandum in at least 10 targeted municipalities. So we will implement the package for early detection of mental problems, for referral mechanisms for expert assistance, and we will promote prevention through education. Then education and training of professionals will be organized through additional accredited trainings for pediatricians, general practitioners, doctors, medical technicians, psychologists, and special education teachers, so that we can improve the capacities for providing mental health care. These trainings will be also implemented by the end of 2025, and the goal is to strengthen the system of support for young people in the field of mental health. And we don't want to forget that health is more than just individual components of health. Development of youth counseling units is crucial for us. Together with primary healthcare centers, we will continue opening the counseling units for young people that will provide support for resolving mental health problems and dilemmas that young people are facing. This program will be rolled out and expanded in the second half of 2025. During 2024 and 2025, the Ministry will, in cooperation with UNICEF and other important partners, implement digital campaigns for awareness raising about the importance of mental health, with the focus on early detection of symptoms and reducing stigma. We are planning to broadcast professional educational programs in Serbian language and in the languages of national minorities. Only through further education of children, young people, and education of parents, teachers, and primarily through high-quality and continuous education of all professionals engaged in activities in this field, only through that we can work on prevention and significantly reduce the effects of various traumas and improve early identification of potential psychological problems, all with the goal of timely response and building a healthy society, because there's no health without mental health. Thank you.
Dr. Stashević-Karlicic, I really like that you started and you finish your presentation with saying there is no health without mental health. And you also emphasize the importance of the community work, which means that we really hope that strengthening the primary health care centers will go exactly under this motto: no health without mental health. Mental health should be embedded within the primary health care centers. And we, and I'm sure our colleagues from WHO, are here to support you in this journey. Thank you very much. Now we are turning to the Ministry of Youth, Tourism and Youth, who has already taken decisive action to strengthen the well-being of young people. And following the Prime Minister's goal, the Ministry started establishing a network across whole Serbia of youth centers where young people can go seek support, express themselves. So, Mrs. Antonijević, can you explain how this is connected with the well-being of young people, and which of the activities of the plan of action you are most proud of?
Thank you very much, Ms. Kostadinova. It is my great pleasure to address you on behalf of the Ministry of Youth, Ministry of Tourism and Youth, on behalf of the Line Minister, Mr. Hossein Memic. When last time we attended this conference, all the panelists, representative of the 6 ministries, we all agreed that depending upon the need that of the assistance that the young people would be provided at this sensitive stage of their upbringing is actually decisive for the problems that will not happen afterwards if the support is timely and focus on what they really need. So a year after, all 6 institutions can agree that with the strong support of UNICEF, we are on a journey to provide this, to make this service accessible. Intersectoral cooperation is most important, and we need to work together. We, as the ministry representing the target group, we are the ministry, youth sector, representing the target group, and our task is, and what we are striving to, is to put this target group at the agenda of all ministries. So intersectoral cooperation is something that is indispensable. We are quite satisfied that through this work with UNICEF in memorandum and the development of the action plan, we made a step forward from the intersectoral cooperation, moved to the cooperation. Not only that we are sharing the information among ourselves, but that the plans that we are devising are developed in coordination, and we've got the approach that would make that all community, as Ms. Kostadinova mentioned, the whole village is dedicated to the development of young people. So what is the goal in memorandum is the mobilization of the community and the creation of the resources at the community level, and that is our task in this area. The Ministry of Tourism and Youth, as of in cooperation with the Office of the former Prime Minister, and now we've continued with the Prime Minister Office, we are jointly developing the network of the youth centers. So they are safe places for young people, which should enable them to have the services in a quality fashion and tailored to their needs. At the very beginning, we heard how important it is that what we do for young people is tailored to their needs. So we strongly believe that dislocating the services focus on the mental health from the institution and placing them into the youth center, I mean, to make the centers places which will show young people that in a safe place, in working with the youth coordinators that are at their disposal, that are aware of the sensitivity of the age of the adolescents, are working together with them, and then they realize that the mental health is not something that you need to keep quiet, that it is not something that you should actually forget, but that is something that implies a good relationship towards yourself. And without such a good relation, we cannot expect to have individuals that would be useful tomorrow for their communities and their families. Last year, we supported 4 towns, Sombor, Subotica, Niš, and Novi Pazar, to develop and set their youth center, whereas this year, with the increase of the resources to 200 million euros, we supported 8 towns to enter into the mentorship process, start developing their programs, and in the coming period, we will in concurrence support them in developing the spaces. So we stand proud and satisfied because we are not simply thinking about the narrow city centers, but we are taking care about the inclusiveness, and we care that the spaces are tailored to the needs of the young people. So Vladičin Han and Boljevac and other municipalities will be supported in that regard. When you ask young people, 60% of them say that their towns, municipalities, villages do have the spaces for young people. They recognize the sport yard and the sports center and the sport club as the spaces for young people, whereas only 12% of the young people that the respondent says that this space is sufficient and tailored to the needs of young people. Apropos the question, what are our plans? Our plans are to develop in each and every community a space which would be a safe place for young people. Not only the spaces, but to develop the program and the services that would be tailored to their mental journey. Now we are talking about their mental journey, but in addition to the mental health, our task is also to develop all other types of the services that young people need for their healthy upbringing. The people not dealing with the employment problems would be at a better position to cope with the problems of her or his mental health. The young people who is into the informal education would be strengthened to ask for support and not to be the part of the stigmatized group. We cannot do it independently, and therefore it is very important to set the partnership with the CSOs at the local level and the local self-governments through the offices for young people. Our ministry, despite the fact that it's not a part of the action plan, but this precondition for the materialization of the action plan, is continuously working in establishing good connection with the local governments. We are working that mayors be aware of the importance of investing in young people, and we are extremely ready that we have a good partnership with the international partners led by UNICEF, and in the past year we supported the programs that were targeted to the development of the program with the Opens in Novi Sad, which is the biggest youth center in Novi Sad, but with other youth centers that are being developed. Our task is to mobilize the business community at the local level, to mobilize educational institutions to comprehend how they can create conditions for young people. The most important cooperation is with the Ministry of Education. Therefore, we are proud that last year in November, Minister Nemic with the Minister Slavica Đukić-Dejanović signed the Memorandum of Understanding where we expressed joint intention that formal and informal education are a unique momentum that actually enable young people that through the programs of informal education, they are equipped with the skills to use as much as possible the formal education in their everyday life. Thank you very much.
Thank you very much, Mrs. Antonijević, for sharing this very ambitious agenda to establish everywhere in Serbia for young people safe space. Because the youth centers, this is the natural habitat of the young people, and they could be supported there, like in the education system. And I want to amplify what you said about the intersectoral collaboration. It is the key for success of our efforts. So that's why now we are turning our eyes towards Minister Žigmanov, the Minister of Human and Minority Rights. Minister Žigmanov, we've heard how much young people are hesitant to seek for help because of the stigma and the expected discrimination towards themselves. And I remember you saying during the previous conference that mental health is a human right. So that's why your work here is crucial, and we would like to hear from you how do you think that the plan of action for the Memorandum of Understanding will contribute to protecting the right of health, including mental health?
Thank you, Ms. Kostadinova. It is also my great honor to be able here to address on behalf of the Ministry of Human and Minority Rights and Social-ecological Republic of Serbia, to be able to talk in this panel. I would like to greet all the guests, representatives of international organizations, colleagues from the government, from other ministries, representatives of civil society organizations, and other participants of today's conference. Of course, the biggest gratitude goes to UNICEF, who gathered us here today, who has been gathering us. They are the organizers of today's conference. I would like to thank them for the invitation. And I would like to also thank them for all the initiatives so far when it comes to our joint efforts, actually joint efforts of all key stakeholders within the government and also within society in Serbia. There were numerous activities, and now we are talking about the issue of mental health and well-being of young people. First of all, I would like to draw your attention to two important activities of the ministry that I am heading in the area of protection of mental health, so that I could explain how we have become part of the community that is always highlighting and repeating that mental health is a foundational human right and a precondition for achieving all other rights. First of all, so far we organized 3 social dialogues on the topic of mental health in 2021, when within our narratives mental health was not discussed so much, then in 2022 and in 2023. In all these social dialogues ended by adopting the agreement of the actions of state authorities and civil society organizations. And in the end, this resulted, and I have to proudly highlight this resulted in establishing a team for mental health that gathers the most prominent professionals in this field. Based on the available information that we received from professional organizations and associations gathering the beneficiaries of psychological and psychotherapy services, we highlighted the following problems, and some of them are still current and ongoing. Lack of a unified register of individuals, professional organizations, institutions, and private organizations working on preserving and improving mental health. Then, insufficient number of centers and counseling units for prevention and improving of mental health and providing psychological services in cooperation with the local self-governments. The need for introducing the mandatory education of professionals to identify risks and to guide children at risk. In the meantime, we saw that the Ministry of Education made some bold steps in this regard. Then the need to introduce mandatory training on mental health and recognizing mental problems in primary healthcare. Lack of continuous primary prevention at all levels to raise the awareness among citizens in the Republic of Serbia of the importance of the impact of mental health on the total healthcare status and the quality of life, first through spreading information and trainings in the field of mental hygiene, starting from the youngest ages, and the danger of tabloid reporting from some media, which violates the rights of victims and stigmatizes the beneficiaries of psychological psychiatric services. In social dialogues, the key observation is the importance of strengthening intersectoral cooperation in coordinated action of all competent institutions with the aim of early detection and timely response, particularly when it comes to younger population. And we could see that now through the signing of this memorandum, under the auspices of UNICEF, this need has been reaffirmed strongly. I would like to add that protection of mental health should be coordinated, comprehensive, and first of all tailored to the needs of young people. It needs to be constantly available. It needs to be on agendas of all institutions, since this appears at various points of life of people. The second activity I would like to highlight today is the joint signing of the memorandum, where we, as the Ministry for Human and Minority Rights and Social Dialogue, we strongly once again reaffirmed and strengthened our efforts to make sure that this concept, this phenomenon in the life of young people, we want to also observe it through the prism of human rights, fundamental human rights, that we need to ensure in the system, in the society. We want to achieve all of them in general. And if any of the rights are, if the rights are threatened, if the mental health is violated, it needs to be adequately protected through the entire programs. When it comes to implementation of activities from the memorandum, in our ministry has activities concerning the improvement of the normative framework in the area of anti-discrimination, then monitoring the implementation of recommendations of the United Nations in the field of mental health, which we also undertook as a country. Then there's prevention of social exclusion, particularly for marginalized social groups. Then improvement the sectoral mechanisms and strengthening the cooperation in the field of mental health, planning public policies and participating in establishing the coordination body at the local level in the field of protection of mental health. And finally, the most difficult of all activity that is cross-cutting for other activities, so combating stigma that is present among the most vulnerable group beneficiaries of psychological and particularly psychiatric services. As the implementer of the activity, the Ministry for Human and Minority Rights and Social Dialogue is in the fourth objective in this memorandum that is related to the continuous monitoring and identification of needs and improving the regulatory and strategic framework to ensure sustainability of the innovative system of services when it comes to the mental health needs. And in the fifth objective, that includes improvement of cooperation and actions between sectors at the national and local level, including educational institutions, social protection institutions, healthcare institutions, offices, youth centers, then penitentiary institutions for children and young people, youth organizations, and other social stakeholders. When it comes to the fourth objective, the Ministry of Human and Minority Rights and Social Dialogue is participating in two activities on harmonizing the legislation with the anti-discrimination legislation of the Republic of Serbia, where the main progress in the previous period was made through active participation in the relevant groups where our representatives of our ministry participated. We worked on drafting the new regulation on the analysis of effects of bylaws. So we improved the forms for preparing the analysis of effects of regulations on the society, which reduced the possibility of adopting any new regulations that would contain provisions that are discriminatory to some of the sensitive groups, including those related to beneficiaries of psychiatric services. So in other words, we are trying to integrate this concept in all anti-discrimination policies and measures. Also, representatives of our ministry actively participated in the work of the working group that analyzed the legislation in the area of protection of rights of people with disabilities, and we mapped several sectoral legislations that contain discriminatory provisions precisely towards people with disabilities. We have work ahead of us through which we will try to eliminate these provisions. Comprehensive analysis of the harmonization of the sectorial laws and bylaws with the law on prohibition of discrimination. We are expecting this during the next year. And for this activity, the ministry ensured the support from the GIZ project, which we will work together with our partners from the Ministry of Labour, Employment, Veteran and Social Affairs. In the work of the Counseling for Monitoring United Nations recommendations, this is an activity within the fifth objective of the memorandum. So implementing recommendations. The Republic of Serbia has more than 650 recommendations on from various international conventions and other mechanisms that United Nations have at their disposal in the field of human rights. So we particularly have in mind the recommendation of the Human Rights Committee, Committee for Economic, Social and Cultural Rights, Committee for the Rights of People with Disabilities, and the Committee for the Rights of the Child. which are related to improving the position of people with mental, intellectual, and psychosocial problems. And we are continuously monitoring we are contributing to the work of this council. The Republic of Serbia went through the 4th round of Universal Periodic Review in May last year. And in the field of mental health, we received the recommendation to continue with strengthening the efforts to improve mental health and well-being, and to further promote literacy and awareness of mental health in order to improve the understanding, particularly through educational campaigns and programs of informal education. In addition to these activities, the Ministry, as a partner in the plan of activities, is participating in activities implemented by other ministries, such as establishing the intersectoral coordination body, financial support for informing young people, parents, guardians about the importance of mental health, and breaking prejudice on mental health in the yearly report on implementation plan, etc. In the end, I would like to highlight that all the listed activities, they basically highlight the necessity of destigmatization of beneficiaries of psychiatric services. So, in other words, their inclusion in everyday life. Many taboos of modern age have been broken, and how society views people with psychiatric problems is one of the remaining and living taboos. Then, when it comes to human rights, we want to protection of mental health is equally as important as any other right, because the right to mental health is the right primarily this is actually a human right, and oftentimes achieving other human rights depends on it. Stigmatization, I will end with this. Stigmatization is usually followed by self-stigmatization. It violates the right to equality, respect, finally the right to treatment, and it is an additional burden when it comes to young people. On one hand, we have disturbing data about the increase of psychiatric illnesses among young people. We heard this from the representatives of both UNICEF and the Ministry of Health. But on the other hand, we are still encountering some hard social norms that are preventing young people to talk about their problems openly and to seek help. And psychiatrist, my colleague Jukic Janic, talked about this. Hopefully, through intersectoral cooperation, we will manage in our intention to take these challenges of protecting the mental health of young people and resolve them together for the general good of young people and all citizens of the Republic of Serbia. Thank you.
Thank you, Manu, for this comprehensive overview of the activities, and the social dialogues definitely are a very important instrument, not only for gathering information and for discussions, but also for increasing the awareness and in this way addressing the stigma and discrimination that they lead. And your work on monitoring the implementation of the recommendations of the United Nations Human Rights Treaty bodies is really crucial to ensure that the legislation of Serbia, and after that the policies and the practices on the field, are in line with the best standards. As you mentioned that you're partnering with the Ministry of Labor, Employment, Veteran and Social Policy, I would like to invite now the Acting Assistant Minister Slađana Marković-Stojanović to address us. In fact, UNICEF is collaborating with the Ministry for a long period of time, and recently we also focused our attention on using innovative digital solutions and SOS support lines to ensure that the young people are supported. But I'll be curious to hear more how the actions, the activities in the action plan will ensure that the most vulnerable will not be left behind. Because usually we're very good in providing services, but the last mile is important, the last mile to reach the most vulnerable. Over to you.
Hvala. Thank you very much. Thank you. I would like to use this opportunity, first of all, to greet all the present here, to extend the thanks for inviting me to be a part of today's event. And I would like to extend a thanks to my dear colleagues from UNICEF, colleague Konstantinov, renowned ministers, my dear colleagues, dear participants. I would like to greet you on behalf of Minister Nemanja Starovic, who unfortunately couldn't be with you today, but I would list all the activities that we've jointly implemented, and our plan is to, and activities that we plan to implement in the coming period. So, we are all here because we all believe one thing, and that is that there is no important thing than the mental health of the children in our society. So we could, and I'm simply echoing that from my predecessor. So when it comes to my ministry, I would like to mention that in our action plan, that we are cooperating very good with UNICEF, that we are developing new strategy for social protection, which will be adopted soon, I hope, and I am glad to see that the colleagues from the other ministries that will be involved in the development of the mentioned strategy shared their activities in the area of mental health of children. When it comes to the cooperation with UNICEF and our action plan, last week, actually, we formulated a special protocol for the protection of children from violation in the social welfare institution, and it will be adopted in the coming days, which is a part of the general protocol and our obligation stemming from the mentioned document. Our focus would be on introducing new services for children and young people at the local level, standardization of those services. So this is a document that we are developing together with UNICEF, and it is titled Concept for Children and Family. The focus would be support to child and support to the family. I would also like to mention a document, a rule book that is being drafted, and this is the rule book on the intensive care for family with children, because we are witnessing that the families are facing BOS. The children in such situation are at risk bearing in mind that we've adopted the strategy for deinstitutionalization and that in the coming period we are going to adopt the action plan on deinstitutionalization, it is of the critical importance to adopt this rule book and implement at the local level. So in that regards, our ministry will intensively work with the local self-government units, and through the earmark transferred and through the engagement of our welfare institution at the local level, focusing on providing support to children at the local level, try to work on preventive activities and not to act in post festum situations. I would like to mention something that is quite topical in our ministry and is not simply related to the social welfare, but is tackling the employment issue, that there is a program. I want to reiterate that we as a ministry are cooperating perfectly with all UN agencies and other international donors. And currently we're implementing the program Employment of Young People, which is called Guarantees for Young People. I would also like to reflect upon part related to the counseling services and social and health services and training session of our colleagues that are working in the social center in the Republic Center for Social Health, which would be the provider of additional training sessions to the people working within the system. I believe that we are one of the ministry that could say that we have a great cooperation with the NGO. Because Our licensed service providers are cooperating with CSOs, and we are supporting the CSOs of veterans and for persons with disabilities. Another thing that I would like to mention is the earmark transfer. That is the amendments to the decree of the earmark transfers that is going to be finalized by the end of this year. So the earmark transfer was given to the LSGs who were under-resourced to implement the social welfare services. This is the personal assistant to a child, assistant at home, and daycares. For the coming period and next fiscal year, we plan to introduce the package of innovative services, because this is the most realistic and the best possible way to help local government. Always focusing on family, on children. So we need to empower the local communities to provide them assistance, so that the beneficiaries are given the adequate service, and to prevent the institutionalization, and to set the better cooperation with the CSOs, with the civil society organization who should be service provider. Without further ado, despite the fact that I would like to share many other things with you, I would simply reflect upon the colleague who spoke about jungling and balls. I believe that the balls are in the air, jungling, all other present here. So our state is a signatory state of the Convention on the Right of the Child. We need a better counseling offices, we need better psychological services in schools, and the engagement of the pedagogists for the children with problems. We need to have the firm and good family colleagues from the youth centers, and I believe that we are on the same page. Thank you very much.
Thank you, Assistant Minister, particularly for highlighting the importance of the local self-governments and the investment at local level, but also the crucial role of the civil society organizations like as service providers, but not only, because we are all on the same page, and only in this way we can advance with the reform. And you also mentioned family. Talking about family, now it's my great pleasure to invite the Minister Stamenkovski, because she's so dedicated to apply a whole of a family approach. And we know that the family is the most important. Usually this is the first support line for children and for adolescents, because in these early ages, children, when they're suffering, they seek support from their peers and from their parents. So, Minister Stamenkovski, what the ministry is planning to do to enhance the support for families, and what resources you are dedicated for this?
Thank you, esteemed UNICEF representative, esteemed colleagues, ministers, esteemed representatives of the government of the Republic of Serbia, representatives of the media, all the stakeholders in the public. This is the second conference of UNICEF that I am participating in, and it is always my particular pleasure to participate, because I learn a lot of things. The topics that you nominate are always beneficial, and I am sure that through your initiative you are setting some objectives for our work. And as we've seen, our work has become holistic, and as we can also see through the memorandum itself. But memorandum is not only letters on the paper, we can also see it in the practice. Our work has become intersectoral, because the topics that we are working on, they require our cooperation to be very stable, very constant, and always to be recognized as absolute priority. It is my pleasure, because only a couple of days after the amendments of the law on financial support to families with children, I'm here with you today. And I want to point out once again that Serbia has, through various population policy measures has become one of the most competitive countries in Europe, and we are showing that we want to, at least through these financial incentives, we want to encourage, strengthen parents and the families. Why am I saying this today when we talk about mental health? So when we think about what is our most important task towards our children, we will understand that it is very simple. Not to allow them to grow up too soon, to be faced with the worries that are not adequate to their age. Because when we all talk about childhood, we can conclude that the best quality of childhood is this carefreeness. And we should provide our care and do everything that we can so that they can be carefree in this period of their life. I think that we cannot talk about interests of children without talking about the family, because the family is the biggest shield for healthy growing up and development of each child. And particularly through strengthening families, as communities, providing the possibilities to children to develop, to grow up, to develop their emotional, social intelligence, to feel love, first of all, to learn about some values and worldviews. Through all that, through empowering the family as a framework, we are empowering the children themselves. I think it is very important to mention that the Ministry for Family Welfare and Demography, in addition to the fact that our desire is for all families to be stable and ideal, we are in the situation that we have to provide care for children who, due to various reasons, do not have parental care, and they couldn't have families as this cell in their society. That is why our ministry, through various projects, primarily by funding the civil sector who nominated this topic, our ministry has recognized the fact that we need to invest additional focus on raising the awareness, and we need to invest in prevention, both when it comes to mental health and reproductive health among children and young people without parental care. In this regard, I would like to inform you that in this year we funded the project Prevent, Don't Treat, intended to young people without parental care, with the aim to make sure that people aged 15 to 22 are provided the necessary information about reproductive health, healthy habits, prevention of sexually transmitted diseases, and responsible family planning. Workshops were implemented in 4 institutions of the Center for Protection of Infants, Children, and Young People in the territory of the city of Belgrade. It turned out to be very useful, and I believe that in the next years, in the upcoming years, we will continue with this project. It is very interesting that by serving the participants in these workshops, these are children without parental care, so when we're serving them, the large majority of them really want to start their own families. So they are striving towards what they don't have, and they are trying to create the values that they grew up without, which shows us that this need for having a family exists even among those who didn't have it. And we can conclude that family is not a habit, but this is a true human need. The Ministry for Family Welfare and Demography allocated 35 million dinars, additional 35 million for programs and projects in the field of raising awareness of the importance of mental and reproductive health of children. But to be very specific, starting from next month, we will start with the caravan, parenting caravan. So in addition to all other activities, it will also include parenting schools. We'll talk to parents, so in order to take care of the mental health of children, we need to talk to those who are responsible for these children and young people. And we need to try, through talking to them, we need to raise all of these important issues, not by being in hotels in Belgrade, not only by being in hotels in Belgrade, although this is very precious, of course, but by going to the most remote parts of our country, being present on the ground and showing that our institutions have this outreach towards citizens, those who need support. We have outreach towards those who don't have adequate access to information, towards those who are not able to follow all these important contexts that we are talking about today. And those towards those people who need it explained in simple terms. You do know that the government of the Republic of Serbia has established the Council for Preventing Peer Violence, and we, as the Ministry for Family Welfare and Demography, we believe that the key word here is prevention, which means that even in preschool institutions, having in mind that UNICEF also mentioned early childhood development, UNICEF is discussing this concept as one of the most important concepts. So first 1,000 days in children's life. We believe that prevention of these bad habits and this wrong approach and relationship towards other people, it is very important to start with that as early as in preschool institutions. And we have prepared an initiative for the Council to become a coordination body, so that its decisions and everything that we are discussing at the Council, so that all of that could be at a much higher level and receive much higher importance on the agenda, and so they can be much more applicable in practice, and so that they can involve all the ministries that are present here, but also include those who are not present here, the ministries who have to ensure and provide support to children and young people in all spheres of life. Definitely what my colleague Ms. Đukanović said, we need to make sure to include the Ministry of Information in projects like this, because children today spend a good part of their time precisely on social media. You know that in Serbia we have a platform Podrži me, Support Me, which is here to take care of the impacts of this digital sphere, and it is protecting children from digital violence. And I think this is also an important part where we need to have actions, because contents like that directly reflect on the mental health of children and young people. In addition to that, it is my pleasure to inform you that we have prepared recommendations to local Serbian governments that the government will adopt with its conclusion, because we want for each local Serbian government, you know, this is the deal. When you go to certain cities, you can be impressed, you know, how they prepared their population policy, their policy in the field of protection of children, youth, family, and legal protection in general. But there are also local Serbian governments who simply, due to various reasons, sometimes those reasons are justifiable, sometimes they're not, they haven't developed their local policies in this field. And we have amplitudes among them. Two neighboring municipalities with completely different practices. One is a role model, the other one is completely non-functional when it comes to these issues. And we decided to establish a unified system with recommendations where each local government should strive towards, because these problems need to be resolved at the source. And together, you know, not only with cooperation between the governmental sectors, but also in cooperation with all local institutions and local self-governments in general. You know that in our ministry, actually various associations can apply for various projects of our ministry, for family and legal protection, for population policy, demography. But our idea for the upcoming call is to open the call where associations working on reproductive health, mental health can apply, where associations working on preventing violence among peers, among young people, among children, but in a proper way. They are doing it in a proper way, without any ideological principles, without any imported recipes, but everything that is tailor-made with the idea to create results for the children, and with the results to draw a line after these projects and see what are all the things that we have actually done. I would also like to inform you that we are preparing the umbrella strategy for the family, which will include all these important topics that you have also mentioned today. Our ministry is investing a lot in projects in local governments for the benefit of children, young people, places where children can spend their time, where they can talk, so environments that is tailor-made for them. But what we see as the most important investment, this investment into the health and development of children and the time they spend with their parents, with their families. So the time they spend with their parents, the quality time, this is the most important investment in the development of children. And that's why we have to create work and economy that is parent-friendly. We are actively working on preparing a certain package of services that would simply guide business entities and the public enterprises to take into account the fact that in the 21st century we need to have this balance between the work and parenting, so that fathers and mothers could spend more time with their children, so that they could be more dedicated to them and detect certain problems timely, respond timely, and definitely prevent some unpleasant scenarios. I believe that a healthy family is a precondition for a healthy society, and our idea is to promote family as such community. It is generally accepted in our society, and this system of family values is not in retrograde here. No, it is living, it is universal, it is timeless, it is always current, because the family is a value without an alternative, and the family system of values is a part of our immune system, not only in our collective being, but also individually to each one of us. And that's why, once again, I would like to say that for the health of our children, for their safe future, for our desire for them to grow up in proper, right people with good character, strengths and values, due to all of that, we need to strengthen families, and this is definitely the most important task of the Ministry for Family Welfare and Demography. And I would once again like to thank you for the opportunity to talk about this from my point of view. Thank you.
Mr. Stamenkovski, for highlighting the importance of the family assistance and strengthening the family, and particularly the strategy for family that is under preparation. And we truly believe that we have the shared vision that empowered families with adequate resources is the key pillars for developing a resilient society. Of course, empowering requires actions, and actions requires funding. So with this plan, the government of Serbia allocated nearly $1 million for the implementation of the plan. Under this plan, 14 policy documents will be developed, and more than 71 activities will be focused on promotion, on capacity building, and on improving the cross-sectoral collaboration. And as I said, we are going to invite 2 more ministries to join this intersectoral collaboration. Thank you very much for your dedication and for your commitment to improve the mental health system for children in Serbia. This is a long process, and it requires involvement of all sides, of course the government, but also all the partners. We talked about the importance of the civil society organizations, but it is also the academia, the educators themselves, the mental health specialists, parents, and children. We also should hear their voices. So with this, I think after this panel, we can conclude that we are all on the same side. Thank you very much. Stasha, over to you.
Thank you very much for these inspiring panel that assisted us better understand how many balls are we jongling with, and how with the joint game and dedicated work is ahead of us. So one of our tasks is to wisely use time and space so as to give the opportunity to everyone to perform their task. Now it's a time to get a rest. And I kindly ask you to enjoy the coffee break and the refreshment until 12:30. And I would like to extend the thanks to our renowned ministers, representatives of the ministries, for being ready to give media statements. I kindly ask you all to ensure that this venue be empty, because the speakers who would join us online would have to try something. So with the joint strands, we'll resume today's events at 12:30.
Dobar dan.
Good afternoon. Thank you for coming back, and we will continue with today's agenda. So, Elena, please take the floor. Dear guest, welcome back. As reiterated in the course of the previous panel, the key step in the improving of the support system is the empowering the cooperation of multi-sector and supporting all partners. So on that behalf, in that name, on behalf of UNICEF, would like to extend the thanks to all partners that enable improvement of the program intended for the well-being and the mental health of young people. We reiterate the substantial support of the involvement of all stakeholders into this process. And now I would kindly ask you to jointly view one short video. Thank you.
Australia has taken many steps and made a big effort to build a strong system for mental health care for young people. We've done that using a series of strategies and action plans, adopted some at the national level, some at regional level, and some locally. We've tried to make support readily available and easy to access, and to ensure that people know when and where and how to get help.
Norway has made substantial efforts to enhance mental health services, particularly for children and youth. In 2023, we launched a 10-year national plan to strengthen and expand these services in the coming years. Key investments include funding a robust school health service that provides discreet mental health support for children and young adults. Our continuous investment in prevention, early intervention, and public awareness on mental health has yielded positive results. We understand that supporting mental health is a continuous effort.
Odmah nakon što nas je UNICEF kontaktirao posle tragedija koje su se desile u Ribnikaru i u Mladenovcu, nama je bilo jasno da nema puno prostora za premišljanje i razmišljanje, da je neophodno pružiti pomoć odmah. Nismo imali puno dilema. Bilo je jasno svima da su u tom trenutku mladi ljudi najranjiviji deo zajednice i da im je bilo potrebno pomoći.
Kao globalni lider u industriji lepote svesni smo svoje uloge, ali i odgovornosti u društvu. Kompanije nisu ono samo što proizvode, već i za šta se zalažu. Tako da su naši brendovi, pored redovnog poslovanja, uključeni u različite inicijative radi pružanja podrške društvenoj zajednici.
In the partnership between UNICEF and the Norwegian Embassy, significant strides have been made to enhance mental health and psychosocial support for young people in Serbia. We are proud that through this collaboration, we supported the first ever international conference on youth mental health and well-being. The collaboration between UNICEF and the Norwegian Embassy has laid a strong foundation for continued advancement in youth mental health services in Serbia.
We're very pleased that UNICEF has given a very high priority to mental health of youth in its programs that it's conducting in Serbia.
Brend je prepoznao veliku potrebu da se pruži podrška naročito mladim ljudima koji se sve češće i ranije susreću s anksioznosti i depresijom. Pored toga, veoma relevantno i lokalno jeste da u Srbiji je tema mentalnog zdravlja i dalje stigma, što mladima onemogućuje da uopšte zatraže pomoć. I sve je to negde dovelo do toga da nađemo fantastične partnere kao što je UNICEF Srbija i da zajednički radimo na unapređenju mentalnog zdravlja u Srbiji.
U UNICEF-u rade ljudi koje mi smatramo vrhunskim profesionalcima, u njih imamo veliko poverenje. Što se tiče konkretno programa, odnosno platforme Sve je OK. Ona je bila u tih godinu dana prvih izuzetno korišćena, tako da kažem, od mladih ljudi u Srbiji. Velika zahvalnost i u ime korisnika i u ime nas ostalih koji smo u tome učestvovali i da naravno UNICEF-ovom timu koji nas je oko svega toga i okupio.
To recognize that no one institution alone can solve all of the mental health problems that we face. It's essential that all relevant stakeholders work together in a very coordinated way to enable effective action to be taken.
Maxiju je misija podrška zdravlju ljudi. U svaku aktivnost koja podržava zdravlje, mi smo zainteresovani da se uključimo, da pomognemo i da to podržimo. Svi članovi društva, da kažem i država, i civilni sektor, i privreda imaju svoju ulogu. I svi moramo da delamo usklađeno i zajednički da bi se neki veliki ciljevi i neka velika postignuća ostvarila.
Rezultati koji smo zajednički ostvarili kao partneri su zaista fantastični, ali je i dalje dug put pred nama. Mi bismo negde zaista voleli da negde našim akcijama motivišemo i druge članice korporativnog sektora da podrže civilni sektor i da zajednički radimo na toj misiji unapređenja mentalnog zdravlja u Srbiji. Ako zaista želimo neke dugoročne sistematske promene u Srbiji, moramo da budemo hrabri zajedno.
In Norway, we have learned that starting mental health education in schools, training teachers and caregivers to recognize signs of distress, and making mental health services available in local communities are key factors. It's also important to listen to young people and involve them in designing programs that meet their needs.
We can all agree in principle that mental health is a serious problem and that we need to do more to support young people, but those words have to be matched with financial resources. And that requires leadership, strong leadership, and I would say enlightened leadership.
The second panel is dedicated to the policies and programs. So in line with that, I'm calling Carol Vignon, UNICEF Serbia Deputy Representative, to moderate this panel and introduce the experts and our guests.
Dear ladies and gentlemen, dear partners and dear friends, I think that since this morning, and with all the interventions we have witnessed this morning, and also with this video, we have seen the power of collaboration and partnership. And this video also showed the extremely powerful impact partnership and collaboration can have. I think we have all witnessed how remarkably the 6 ministries have been able to come together with very strong commitments and work plans to support the establishment of mental health services for all children, adolescents and youth in Serbia. Zajedno, together. I think the title is very well chosen because it's about the collaboration between ministries. It's about the collaboration between the local self-governments, the civil society organization, the communities, and the parents, and we will have the opportunity to discuss those later this afternoon. And it's also the collaboration and the day-to-day partnership between the parents, teachers, health professionals, every day. This collaboration and partnership happens at so many levels. And I think you have noticed, like me, that they always revolve around 2 aspirations, which will be some of the foundations of the future of mental health and psychosocial support services in Serbia. The first is connected to the design, planning, and financing of mental health and psychosocial services locally anchored in the health, education, youth, and social welfare in Serbia. The second is connected to the provision of skills, capacities and knowledge to all the health, education, youth, social welfare professionals, as well as the parents and the peers. All of this does not come without any effort. It requires policy design, it requires program development. And I'm very pleased today to introduce the panel of our 4 experts who will explore with us program design and policy development around mental health and psychosocial support. I would like to call, first, I would like to present our colleague online, Sofiane Kalfaoui, whom you should see very soon with us now. Sofiane, you are a mental health advisor at the Zurich Foundation. You are calling from Zurich. We are very happy to have you with us. You have an extensive experience in the design and implementation of resilience programs for children and youth in several countries of Africa and Middle East. We are very happy to have you with us today. I would like, and I'm very, very pleased and honored to invite Dr. Verica Jovanovic, Director of the Institute of Public Health of Serbia, Batut, to join me on the stage. Dr. Verica Jovanovic is a guest lecturer at the Faculty of Medicine in Belgrade, and she is championing, together with a strong and impressive team of the Institute of Public Health, high-quality research, programs and projects to inform national health policies. Verica is also a long-time partner and friend of UNICEF.
Thank you very much.
I am also very pleased to invite to the stage Dr. Milica Pejovic-Milovancevic, Director of the Institute of Mental Health, child psychiatrist, professor at the Faculty of Medicine, and a fervent advocate of community-based services in MHPSS and the collaboration between health, education, and social welfare sectors. Milica is also a long-time partner and friend of UNICEF. And finally, I'm very pleased to invite to the stage my dear colleague, Leah James, our UNICEF Regional Advisor on Mental Health and Psychosocial Support, covering all of Europe and Central Asia. Leah James holds a PhD in social psychology and social work. She has an extensive experience in designing, implementing, and evaluating MHPSS interventions around the world. So before we proceed to the key interventions and presentations of our panelists, I would like all of us to take a minute to reflect and to recenter about our why. I've been told that we are more than 230 people in this room today, and that people traveled from all over Serbia. So I would like to express our sincere thanks and pride of having all of you today with us. And I think it doesn't come by chance. I think it comes with a very strong reason. That's why I would like to ask a very simple but very personal question to our 4 panelists, but also to all of the audience. You can take some time for yourself, for a bit of introspection, around your why. What is your personal motivation to work in the field of mental health and psychosocial support? What keeps you on going every day? I would like to ask Sofiane first to respond.
Thank you very much for welcoming me. I'm very honored to be part of this discussion and to be with you in Serbia. I mean, to simply answer the question, the first thing that comes to my mind is I wished that as an adolescent, I could have access to such knowledge about my emotions and feelings. And I do believe in the power of emotional literacy to thrive in life, both personally, but within our family and communities. This is also a way, I think, for the new generation to take decisions differently and form positive coping mechanisms on a daily basis.
Thank you very much, Sofiane. Verica, what is your why?
My basic motivation is my personal motivation, but at the same time motivation that is provided by my institution at the task to create the area of mental health through a multidisciplinary approach in the community, as today's conference reiterates, that we together reach the improvement of the quality of the health and all prerequisite for functioning of the society and the population and individuals in a safe, satisfactory way, in a way that each and every adult or any individuals can attain. Mental health is a part of the overall health. It is critical. We sometimes do not recognize what mental health is, but without the mental health, then it is all reflected on all different segments of our life and work. And that is the reason why. Thank you very much for the post question. First of all, I would like to greet you all. I'm very glad for having this conference. Thanks very much, UNICEF, for grouping us in such a large number. I would be completely personal. The best wisdom for me was the delivery of a child or childbirth, because I don't know, since the moment that I've started to be career, I wanted to deal with children. Medicine was my choice, and then the story of the child psychiatry came naturally, because I believe dealing with the soul and dealing with the tiny emotions, assisting a child to develop into a personality is something that is most important for me. So those small children that are close to my heart, the baby is something that is perfect for me, and that's why I'm dedicated to early development, and those children that are growing up, dedicated, we grown up create a world to our extent better for them. I'm afraid that for the time being we haven't managed to create a better world for them, but these kind of conferences could brought some tiny chances to make the world better for our children. I love working with children, and that's why I endure, and I will continue enduring and striving and working with the children.
Act to follow. Well, first of all, hello, everyone. I'm really honored to be here. I'll also share, I think, from sort of a personal angle. I initially became interested, so I was living in New Orleans after Hurricane Katrina, and was very interested in sort of how we as young people, I was a young person then, were coping and not coping in many cases. And I got to see and sort of experience how supports, even really basic supports, can be just incredibly powerful and meaningful. And I think it sort of hooked me. And then now, continuing sort of in that vein, I think it's been an interesting line of work in the sense that you hear really hard stories, right? It's difficult, but on the other hand, you get to hear and to sort of bear witness to these really amazing examples of resilience, of course, as well. And you get to see how people cope with things that are just incredibly difficult. And I think in many ways that's such a privilege. It feels like such a special place to be, to get to see that. And in the same way, you know, that there's vicarious trauma or vicarious stress, there's also, I think, vicarious resilience. And so it impacts me in meaningful ways, and I feel very lucky in regard to that.
Thank you so much for those very inspiring introductions. I would like to invite Sofiane now to speak to us about the benefits of investing in the mental health and the new models of collaboration between the public, private, and non-profit sectors. Sofiane, over to you.
Thank you very much. And just a few words of context first. Serbia is very dear to my heart. I used to work with Save the Children for many years in the past, and I covered Serbia as a priority country. And I'm very humbled to see all the work you're doing for children and young people today. And really, I think Serbia can be a model in Europe in terms of pluri-sectoral contributions to youth mental well-being. The second thing I'd like to share with you is that I am the head of the Improving Mental Well-being pillar at the Dead Zurich Foundation. The Dead Zurich Foundation is the corporate foundation of the Zurich Insurance Group. And last but not least, I must emphasize the fact that UNICEF is a great partner of ours. We have been collaborating for many years now. And we're just starting a new phase of partnership that covers several countries over the world. So I think as of today, different pieces are coming together, which actually provide an element of answer to your question, Caroline. So first of all, I must say that from the foundation end, we are really involved in the prevention and promotion spaces. We do believe that working with young people on the prevention and promotion front is the greatest form of protection. It's about making sure that young people are feeling empowered to speak up about how they feel, they know about their emotions and feelings, and feel validated to search for support. But before actually this end line, this ultimate impact is created, indeed, it creates a collaboration between an endless list of actors to make sure that young people are supported, that caregivers are involved, and making sure that their whole ecosystem is actually supported. This being said, I have observed today a great momentum for public-private non-profit partnerships to happen. Everyone recognizes that mental health is actually universal. Every young person in the world, similarly to physical health, is in need of knowledge and in need of solutions, should it be needed. Therefore, we must collectively activate the power of the togetherness. Today's mental health, for young people specifically, is like a hidden pandemic. And when it gets to provision of funding, provision of expertise, access to young people, thought leadership, advocacy, innovation, and so on, it's a matter of coming together with this objective in mind to positively impact youth mental well-being. At the Zurich Foundation, all the programs we commit to are actually involving the private sector from the Zurich end at the minimum, the public sector working with a series of governments similarly to the contributions you do in Serbia, and with partners such as UNICEF or local NGOs. When we speak about system change here and the power of collaboration, we speak, for example, about how to change a secondary school curriculum, how the Ministry of Education, in this case, could be the pathway to change the secondary school curriculum for mental health to be taught to young people similarly to sport and physical health. We speak, for example, to engage a federation of a given sport for all the sports coaches to be trained into the topic of youth mental well-being and train athletes accordingly. We speak, for instance, about engaging caregivers and parents, as I said before, to build protective environments, which means that it's everyone's role. But last but not least, what is important here is also the fact that we aim together to scale, and we must be relatively fast. Indeed, one or another of us would never be able to go so deep and so wide in the impact versus doing it together. I'd like to mention an example. With UNICEF, we have created and launched what we call the Global Coalition for Youth Mental Health. This is led by UNICEF, and this is, as of today, gathering a series of private sector stakeholders that then contribute to UNICEF programs, who then work with public authorities and local partners. And I have to say, in 2 years' time, the power of this coalition to really embed and activate the power of the collective is extremely strong. And we see like a snowball effect happening, where the private sector, for many reasons, feel both empowered to support UNICEF and other partners for youth mental health, but also to embed best practices to make sure that young people within our organizations and companies can actually benefit as well from youth mental well-being prevention programs. Which means, in conclusion, that everyone has got a role to contribute expertise, financial resources, advocacy efforts, but also to implement within our own houses these principles about youth mental well-being. So it's not only about thinking whose role is it to implement and create impact, everyone has got a role to play. And at the end of the day, this is what we can call system change.
Thank you so much, Sofiane. Thank you. Thank you for recalling the Global Coalition on Mental Health, which Gabriele mentioned this morning. I also think it's a very good illustration of the power and impact of coming together from very different perspectives and different areas of work and interest. I also take note of the mention regarding the benefits of investing in mental health. I think the ratio is that if you engage $1 for mental health, you get $5 saved for global health outcomes, which is quite impressive. So thank you very much, Sofiane. And I'm very pleased to give the floor now to Dr. Verica Jovanovic, who will speak to us about the crucial role played by high-quality data to inform policies, strategies, and decisions, and also to guide interventions.
Thank you. Carol, this was really a good introduction, and this is a good topic for this panel, and I will present on behalf of the team that is working on indicators of mental health and psychosocial well-being of children, adolescents, and young people in Serbia. Of course, this was done with the support of UNICEF and the Ministry of Health. So I will talk about the importance of certain data that are in possession of such institutions. Data are a precondition. They are a key for adopting the right decisions in line with the needs, not only when it comes to mental health, or when it comes to psychosocial well-being of children, adolescents, and young people, but also when it comes to the entire field of public health. And it is so broad, and it shows us that there are interactions between various data and between selection of data assessing the status of mental health of children, young people, and adolescents. And it shows that, of course, we need to have a multidisciplinary approach in this, and we need to select the right indicators that will give us the most realistic overview of the mental health situation of the population, but at the same time, they will give us the picture of the mental health of young people. And we need to monitor all changes that come over time through improvement of various technologies that we are surrounded with. Various changes in how we approach the media, when we talk about communication through social networks, etc. And all these challenges that are present, they also need to be one of the parameters that will be assessed so that we can make the best possible conclusions that are based and supported by data. And knowing that today, in addition to qualitative research, in addition to actually quantitative research, we have data analysis from routine statistics, and we have numerous qualitative research that is slowly taking the primary position for the most realistic assessment of the healthcare status and needs, both for young people and for the general population. And we know the challenges that we have, and we know how multidisciplinarity and support, both from UNICEF and all others, is so important. When it comes to the content of my presentation today, I would just like to highlight the importance of monitoring the mental health, because this is actually based on various data, and this is used for development of the framework of indicators in this field when it comes to mental health. And these selected indicators of mental health, they are definitely related to the most important indicators that can have an impact on policy making and creating programs and some smaller activities that are necessary for making legal decisions by decision makers. As just like the name of today's conference says, and I will have to repeat it, together we are on the same page, on the same side. This means that all these ministries that you can see are listed on this slide. All of them have a very important role to play, and I really don't know which of these ministries and which of these sectors is the most important. I don't know which sector actually is the most important to pick, you know, the best indicators for monitoring the mental health of children and young people. Everybody will give their contribution. And of course, the clinical medicine and people who work on health of children from their birth, then experiences from other countries, this will also definitely have a contribution. But the role of the Ministry of Education, where children spend maybe the large part of their day. Then we have the role of the Ministry of Labor, Employment, Veteran and Social Affairs, Ministry of Human and Minority Rights, Ministry of Family Welfare, Ministry of Tourism and Youth. So based on active participation of all the listed ministries, there is a goal that refers to establishing a model of cooperation and achieving the greatest possible level of consensus and efficacy when it comes to defining the directions of work in prevention and when it comes to defining how to resolve problems regarding mental health and well-being of children, adolescents, and young people. And of course, if we want to monitor the progress and identify various needs to enhance interventions, to have highly efficient interventions in public health, everything under the auspice of public health activities, it is important for us to have available high-quality data that are relevant for assessing the real situation of mental health of various population groups. I'm just showing here all the types of data that we have available. So these are data on organization and functioning of the system when it comes to the healthcare system, but also for other systems as well. So those are data on the determinants of mental health within various domains, and various data on the burden of disease. And all the above data is collected through routine statistics and targeted research. But really, sometimes these data are not complete. They have some series of deficiencies. For example, we have data about the number of registered occurrences of a disease or a condition, but for example, these data are not disaggregated by sex. Or maybe we don't have data about the geographic distribution. But maybe over time we have a need for data to be even richer. Maybe some indicators are missing, and that's why the continuity in terms of improving these data, the quality of data, that's why this is of paramount importance. For today's work, I would actually like to show data coming from research, HBSC research. This is such research of healthcare needs when it comes to health of children in territorial country. So we did the first research with the support of WHO back in 2017. So we used a representative sample, and as a country and as a system, we entered families of the countries who are conducting the assessment of the healthcare of school-age children. I wanted to show this data because these indicators are not part of the routine policy. Those are used in qualitative research, but this is also the data. Actually, we analyzed quantitative data on the representative sample in certain schools and children. And this was done in cooperation with the Ministry of Education. So we did this research. After 2017, we did it in 2018, and then once again we did it in 2022. And this research included students of 5th, 7th grade of primary school and 1st grade of secondary school. But my question is this enough? The dynamics of such research is once in 4 or 5 years. And this is a period when we can expect certain changes, but these parameters that were established based on the experiences of different countries, we really monitored all that. And here I will show some selected indicators of mental health that we need to take into consideration. So subjective health problems and the prevalence of students who had certain health problems, this is showed on this slide. They said that at least once a month during the previous 6 months, according to the data this is the research from 2022, so they said that around 40% of students expressed this data. What was the situation in certain grades where we conducted this research? So they were more courageous or maybe more sensitive, and they said that there is this discomfort. They notice some health-related problems. And now, when it comes to family relations and relations within schools, the question was whether and how they communicate with parents, with their fathers, mothers. We can also compare the situation in 2018 and the situation in 2020. So the communication with parents, good. They have a little more frequent communication with mothers. When it comes to students who are seeking support from the family, the results were good. They were 80% of cases was in 2018. It was a bit better compared to 2022. Maybe this was under the influence of COVID also. This percentage in 2022 was a bit lower. The only difference that is significant, and we can look at it, this is about the percentage of students who feel that they are very burdened by schoolwork. This was particularly prominent during COVID pandemic, since the research was done immediately after the intensive stages of COVID pandemic. So there was some differences here. And here we can see some questions and answers to these questions. So whether students aged 15 felt nervous more than once a week. Those are their personal statements. So in Serbia, there's an average that is not that different from the average in other countries. On the left-hand side, you can see all the countries where the research was done and how they felt. So whether they were feeling low or not. So girls are those that were more open. They said yes, they were. They were feeling a bit more low. The average was 44% of responses. When it comes to whether gambling was present and what was the model, so whether this was children at risk or maybe problematic gambling. So we have some data which is not encouraging, which should be taken into account. So gambling is present. So from 2018 only almost 24%. And when it comes to data for students of first grades of secondary schools, these percentages are of course a little lower. We discussed during the research itself, we discussed the problematic use of social media. And we used the scale, social media disorder scale. There were 9 questions for the 12-month period preceding the survey with the yes or no based questions, and the feeling that they could not think about anything else other than the dissatisfaction when they cannot use the social networks. And really, social networks really are prevalent in the lives and behavior of our children and young people. This is also one of the findings, if I may say so, one of the findings of this research. So what would be our task now? With the support of UNICEF, this would definitely be easier. So, I mean, this is an international trend and international task that, you know, these problems don't know boundaries between countries, you know. New phenomena, new technologies, they will definitely have impact on the health of young people and on their mental health. So the Institute, actually, with the support of UNICEF, we will initiate the process of mapping of the existing sources and types of data. Maybe now it's time for the sources of data to be changed a little bit. You will help us with that. All of the associates from all other sectors, of course, with the support of UNICEF. I think this will definitely go faster and smoother. And but the domicile population and the way of life, actually considering the needs for establishing the list of indicators of mental health, this will definitely have an impact on the more efficient systematization of these indicators. And based on that, we will propose a set of key indicators in the field of mental health for children and young people. Through a coordinated approach, it would contribute to planning and development of a comprehensive support to mental health and well-being of children and young people, and monitoring and evaluation of their success. So our task is for these sets of indicators to be drafted, to have the high quality, for them to be applicable and achievable. And based on them, of course, with the line ministries, with the entire community, we want to do as much as possible and to have high quality work in order to preserve and improve mental health of children, adolescents, and young people. Thank you.
Thank you so much, Vejca, to highlight the importance of high-quality data to inform policies and strategies, and also to take stock of the excellent work that has been done so far on establishing data collection system, but also to show the way about what remains to be done. And I have to say that UNICEF is very proud and happy to partner with the Institute of Public Health to support you in this endeavor. And now I would like to give the floor to Dr. Milica Pejovic-Milovancevic, who will speak to us about the crucial importance of supporting the collaboration between professionals from the health, social welfare, and child protection, as well as education and youth sectors. Milica will also present us a new community-based model of support, the Youth Minimum Service Package.
Thank you. Hvala, Carol, još jednom. Prošle godine smo se...
Last year we parted. Actually, we've got the slogan, "Do not leave us for later." If someone had told me that in a year's time we would manage to do a lot of things, I was quite skeptic back then. And that's why I put the title, Youth Mental Health, The Future Has Come. Because I don't know, as much as it sounds simple, group and have such a high dedication of 6 different ministries, and Professor Đukić-Danović rightly noted that the Ministry of Finance and Ministry of Information are missing. It is a huge success, and before starting, it wouldn't be possible without the UNICEF office and dedicated and committed ladies working in that office, led by Diana, who has a vision. And I was very glad when I met Carol, when Carol joined us, because we could have done it just through a joint strength. What do we know? You need to define the mental health and psychosocial support. Yesterday, Gabriela and I spoke a bit, and I said maybe we should have focused immediately on the mental well-being, not on the mental health. We, people sitting here, we are dealing with the mental well-being of young people. Mental health is just one segment and very important, but story about the mental health is just one puzzle in the whole image of what we need to ensure to preserve our mental health. Because when they come to us in our tertiary healthcare institution, we are late then. And it is very important that we think in that direction. So mental health is more than just a pure health. It represents everything that an individual can have with herself or himself, peace inside and inner and outer peace, and the way that he or she communicates with the society. And that's we are talking about psychosocial support, the support how to overbridge a problem independently, how to resolve the problems you're facing with, and how the society, how could the society assist within the social segment. So it is very important that we are aware of the cooperation. And again, in these few days, we've been thinking, is it just a multi-systemic cooperation? Should each and every system provide the part that they need to assist the mental well-being or mental health of children? Or to do what we thought about yesterday, should we opt for a cross-sectoral support? Meaning, let's group ourselves, focusing on one topic. Is it a minimum set of services to join our strengths and to help? And I would simply say you had the chance to hear from Professor Jovanovic what is the situation. We are involved in a research. The data are quite worrying, but we would wait till the end of that research where we will give the data how much problems we have here in Serbia. And that is not a novelty. What I would like to analyze in the future is what is causing mental health problems. Because as long as we are not providing the world to the young people where they could have safe spaces, where they can breathe clean air, where they could have basic opportunities, people satisfied, happy, and fulfilled, providing them support, I kindly ask that the next conference would be caring about us, taking care of young people, because all of you sitting here are working with young people, and that's why you're here. And you know how much support we need. I personally felt it in a year and a half ago, and I'm very, very, very grateful to my colleague, to the Norway, and I would like publicly extend a thanks to the colleagues from Norway. It was hard. It was the hardest year and a half that I passed, and you know what has happened as of May. We need a greater number of people who will sit with adolescents and young people to converse with them. We need more health services within the mental health sector. We know how difficult it is to get new service and how much efforts we all need to invest, and we constantly need to be educated and constantly be reminded. Deal with young people, because that's how we invest into our future. And how do we do it? You observe there is a political will. Thank Diana. I really believe that it is your success because you've managed to consistently request from politicians that, and thank you very much. I know what you did for us. Policy, legal framework, advocating, funding are critical. Is it $1 million? It's a perfect start, but we need much more dollars. But I believe that we will succeed to find additional funds. Multi-systemic approach and communication channels are very important, and we are trying to find the way how to better communicate. Then again, we do believe that all 250 sitting here, we want to help young people, their parents, but sometimes in our cares, we forget that there is another sector in need of our support. In here, I would like to extend the thanks, unfortunately, in our tragedy, we observe how we can cooperate very well. We, from the Ministry of Mental Health and from the medical sector, we are equally breathing with the Ministry of Education, and we establish a very good cooperation. And now it's much easier. We know that we've got the people. Thanks, Snezhana, for everything. And this is the opportunity to extend the thanks. The development of capacities of the personnel is something that is continuous, that should exist as such. And to have it all, we wouldn't be able to do it without the data. And that's why what Professor Jovanovic mentioned, that's why we need different researchers, and researchers are costly. And we need to allocate the fund for researchers to get some information. Just briefly, I know that we talked about the action plan, but I want to briefly share with you what does it mean. It means that in the next 3 years, we need to have information to provide good quality information to young people. We need to more efficiently use resources at our hand. Well, we are sitting here, and this is a great resource to widen the group of us, to widen the spaces where we can work, to have better accessibility to support services, to constantly monitor, to be constantly present in all of it, to work and to cooperate at the local level. We have the perfect example of the local memorandum of understanding signed in Zrenjanin. I don't see the colleague from Zrenjanin. It's a great way how they did it. They haven't dealt with young people. They signed the memorandum for early intervention for youth, and that's great mechanism and good example. So we've got our national good example. So let's replicate it in 10 other towns. Improving the cooperation at the republic and the local level, of course, different mechanisms involved. Well, my idea, what I would like to do, what are 3 basic directions? This is really perfect way. A minimum service package is a well designed thing for psychosociological support. So we, from the social welfare colleague from the education, created one framework, joint framework, where we believe that we need to act and in a way think in the same way, to observe the signs in the same fashion that should actually concern us, to have the same action or response when we observe those signs, to know who is in charge of what. And this is a good set, and afterwards in the afternoon session you would hear a bit more. So within that, we've tried to develop something that is calling staged treatment. Not each anxiety and depression are disorders. Those are crisis symptoms. Every one of us felt anxiety. Professor and myself felt anxious when we sat here. That's normal. But when it are bigger than the capacities, then it's when we need to react. Our colleague in the institute know when we need to respond, but I would really love that we don't get everything, because I'm sure that a lot of things could be resolved at the level of schools and the social welfare centers and elsewhere. Peer support, that's great that we've got young people, because they can assist a lot. And of course, what is called community care, SESAM. I wouldn't focus on it, but I would like to extend the thanks. They helped us a lot. I do remember when 3 years ago, Mr. Vučković came to us in institute, said, now adolescents are in focus. We've just ended out with early development, but that was a great story. And then I said, which is the best model in the world? In Australia, they are the best model, and UNICEF assisted us and helped us to get in contact with origin, with the best, and to learn from the best. Yes, we know it all. We know to recognize what's depression, what's psychosis. But origin has something that we are lacking, and which is well-packed something. So we've got something that's well-packed. Then our building, and we are not Australia, we are Serbia, assist us a lot. And that is something that was very important in the whole mentioned process, establishment of the joint team, supporting for adolescents, establishing the referral pathway, establishment of the stepped care model, and my colleague Maria would speak a bit more about it. Well, I need to reflect upon something that hurt us for this 18 months, and that's why I'm glad that we had a chance to hear from the President of the World Health Organization here in Serbia, that he said that the government of the French Republic put the priority on mental health. Our government in 23 created the working group, which was called Working Group for Mental Health and the Security of Young People. So at the very beginning, we dealt with the crisis. We still are focused on crisis, but we jointly with UNICEF, jointly with the Association of Psychologists of Serbia, managed to develop some other things. Now, we are continuously, I would just share with you the data, are providing psychosocial support for 18th month, and we've been working and dedicated to different group activities, and the total number of young people we cared about, not through the institution, but simply through this activity, whether it was Dadov, it was Vladislav Ribnikar, was it Children's Cultural Center Belgrade, and CESAM, outside institution at the local level, and that is a good model, and it has proven to function properly. So more than 400 and 300 young people and children were provided a kind of a support in the period of the past 18 months. And now it is my great pleasure to show you the crown of our activity is actually the opening Center for Youth that is dedicated to the mental health of young people, and our CESAM is in Resavska 22. Come and visit us, cesam.rs. We've got the Instagram pages. We are dealing with providing psychosocial support. We're dealing with prevention. We are involved in the volunteering. We are dealing with parents. We are dealing with children and youth from 10 to 30 years of age in the community, in the wonderful venue and space. What have we done so far? CESAM was officially open on 25th of April. It started operating a bit before. In the course of this time, we had 458 sessions, and now that number increases. And the young person can come to us to get 5 counseling sessions from the renowned experts, and after that, in 5 counseling sessions, they resolved a lot of dilemma of young people. When they need it more, then they will proceed with further counseling sessions. We've organized different events, and currently we are having 70 volunteers. Those are young people. That is the strength of our season, and we do believe that with them we would reach higher results. And what is important is that we need to continue working at the community. We want to expand our voice, and maybe to focus on mental well-being, because when I hear mental health, it occurs to everybody thinks of the mental illness, but mental well-being, mental health is above the mental illness. To continue with e-counseling, you heard a young person who nicely put it, to prevent the stigma and discrimination. Let him online, get connected and converse with the experts, and that's good approach. And of course, our idea would be, and I would reiterate it, to at least open sesame in 3 additional towns, Kragujevac, Niš, Novi Pazar. Why there? Because that's where we've got the most number of experts who would be involved, and Novi Pazar is reaching young people. So that's what we would like. I hope that we are together on the same page and that we would jointly continue.
Thank you so much, Milica, to recall us the urgency and the importance to continue to invest in mental well-being and in a dedicated and capacitated workforce, and also for showing us the innovative approaches on which we have been partnering together, Sesame. We are very proud as well to be part of this journey. I'm going to give the floor now to Dr. Leah James, my dear UNICEF colleague, who will discuss and present to us the different approaches and training packages UNICEF has been developing worldwide. Leah, the floor is yours.
Thank you so much. First of all, again, just such an honor to be on this panel with colleagues who are doing such amazing things. Just the achievements in the last year are really remarkable. And I guess at this point, I'll zoom out a bit, actually, to the regional and the global context, share a little bit about what UNICEF is doing at those levels in regard to system strengthening, I think in the hope that it's also useful. So just very briefly, starting with UNICEF's theory of change, I think this is not news to any of you, but it draws from the social-ecological model that situates children in context. So quite clearly, to support children, we must also support their caregivers, their community, including their schools, and the system, broadly speaking, so including social services, education, healthcare. In Europe, for UNICEF, this system strengthening piece is really key. This is sort of the main piece. And of course, it means work led by and in collaboration with governments. It includes advocacy, policy and legislation, resource mobilization, capacity strengthening of the workforce. And I know you've heard this 100 times today. I'll make it 101. But it's absolutely fundamental that the system strengthening adopts a multi-sectoral approach, and better yet, a cross-sectoral approach in which all sectors are working on this topic, not just in parallel, but actually together, that are sort of, as Gabriele said, juggling together, and therefore sort of lightening the load of each sector. We need to meet kids across service delivery platforms. This requires coordination, including at the interministerial level, but also at the level of service providers across disciplines. And again, Serbia is well ahead in this regard. There's agreement, there's plans, but now it's the time, of course, for continued implementation, and I think the hardest part in lots of ways. It's not innovative at this point to talk about multi-sectoral coordination, but it's still innovative to achieve it. And so I'm hoping we'll see that here in Serbia. A key component, of course, of system strengthening is investment in the workforce. This includes training, of course, but it also includes promotion of ongoing high-quality supervision and spaces such as communities of practice to support learning exchange. I want to highlight just a few tools that are focused on foundational skills. EQUIP is a very, I think, useful evidence-based tool which aims to strengthen psychosocial support skills among helpers by providing essentially a method of assessing capacity. So, for example, for use in supervision sessions, and you can see here, it's kind of small, sadly, but the WeAct tool, which is for assessing helping skills for use with children, and I think is very helpful in sort of identifying what those foundational skills actually are and assessing them, even through self-assessment. It doesn't need to be sort of monitoring and evaluation sort of thing, but something to kind of keep track of capacity over time. Sorry. I think in terms of capacity strengthening, the focus needs to be on multisectoral specialists and non-specialists, so across education, health, social services, also legal and justice professionals, and those providing community-level prevention and promotion activities. So volunteers, for example, coaches, art teachers, really everyone that engages with children in any capacity, deserves and can benefit from capacity strengthening in regard to these foundational skills. And EQUIP, mentioned earlier, is, I think, suitable for all sorts of helping workforce. We've now started to think creatively as well about online tools to ensure that providers can access capacity strengthening resources. There's here the IASC MHPSS minimum services package. This is separate tool from the youth minimum service package that we've been hearing about in regard to Serbia. This is a tool for emergency response in particular, but it is a multi-sectoral approach that really creates in a very easy, very user-friendly way, very clear guidance about what role every sector can take in an emergency in regard to MHPSS. Also training materials for the social service workforce aimed at supporting communication and addressing biases among the workforce themselves. There's the learning passport, for example, to train teachers and basic life skills for youth workers. And I can certainly, if you're interested, provide more information about all of these tools, and I'll share contact information at the end. Actually, before I proceed, though, I wanted to mention that in addition, I think, to use of digital approaches for training and supervision purposes, there's growing focus on how providers can facilitate activities and provide counseling remotely. So through digital applications, for example, which, as we know, is a stigma-reducing approach, but we need to do so in ways that are safe and effective. We need to think about sort of risk and safeguarding in regard to use of these tools, to think also about how to create online spaces that can harness the positive effects or the positive elements of social media, because there are positive elements of social media in regard to peer support. But protect against risks of cyberbullying, promotion of problematic norms and ideals, that sort of thing. And so this needs to be an area of capacity strengthening as well. We need programming that's informed by and based in evidence, and happily we really do have a strong evidence base on MHPSS for youth. At WHO and UNICEF, we've developed the Helping Adolescents Thrive Toolkit, for example, which includes a bunch of different tools, the social-emotional learning guidance for teachers called Magnificent May, an intervention to support caregivers of adolescents, also EASE, which is more recently developed evidence-based group intervention for early adolescents who have mental health symptoms. And then other tools relevant across the lifespan, including for caregivers of young children, called Caring for Caregivers, and across layers of care as well, so including prevention and promotion interventions for non-specialists, like Team Up for coaches, Play and Heal, which is in collaboration with LEGO, and an art-based intervention and development. We know, of course, that youth participation and leadership are really critical. You've heard this today as well for effective MHPSS, but it needs to be meaningful and not tokenistic, which means that programming, of course, should be informed by input from youth and caregivers, but in an ongoing and sustainable way, so moving beyond just an initial assessment or consultation with youth. We need, for example, an approach to youth advisory boards that is, or other mechanisms that's efficient and that's sustainable and that's engaging for both youth and for decision makers. And we need systems for youth development of materials, stigma reduction campaigns. When youth develop them, they're much more effective. The Spotify partnership that UNICEF has to develop the On My Mind podcast is an example of a resource developed with youth that has been very well received. Research and data, as we've discussed, can be collected with youth and is likely to be very effective in that way. We should promote interventions that entail peer support, so youth supporting each other, like I support my friends, which I think you'll hear more about later today. And finally, I think youth distress, as we've discussed today, is linked in many cases to world crises, right? To kind of existential concerns that youth are having around climate change, around socioeconomic instability, around war and social tensions, around unregulated social media. And so there's really a need then to promote youth advocacy on topics that matter to them. And to do so in really a sort of strategic way, right? There's, I think, a lot of resources now that are about giving youth a platform to sort of speak truth to power, but we can do more to understand, again, how to do this efficiently and sustainably, and to do it in a therapeutic way for those who are involved. So to think about integrated MHPSS and advocacy interventions. So of course, we know that collective efforts to make change can be incredibly empowering and healing for youth, and are effectively MHPSS interventions in themselves. And we can pair them, integrate them with other kinds of approaches, mental health approaches as well, and I think this is really necessary in today's world. Okay, last thing from me is regarding the well-being of the workforce, and this was mentioned by my colleague just a bit. I think, as we all know, this work is really hard, and we and our colleagues deserve well-being support, as do the children we support, because we know when the workforce is burnt out, this often influences the quality of the services that are provided. And I think what's really key is that we need to approach this as more than just self-care. I know we've had really wonderful self-care workshops. However, we need, I think, a different approach that has to do with organizations and institutions taking responsibility for the well-being of their staff. For example, through establishment of well-being policies at organizational level and dedicated budget. And UNICEF in the regional office is developing a toolkit to guide institutions to develop their own staff well-being policies through a participatory process with their staff. Also guidance on how UNICEF can support the well-being of implementing partner staff through the partnership process. So for example, including staff well-being criteria for partner selection and through dedicated budget lines. And so thank you, and please be in touch.
Thank you. Thank you so much, Leah, for giving us this global overview of existing tools and training packages. And being conscious of time, I would like, but the question is absolutely fundamental, so I'm going to ask it to Professor Jovanovic and Professor Milovancevic. I would like you to tell us about your vision, about how you see, how you visualize the best but realistic scenario for the state of mental well-being and psychosocial support in Serbia in the next 5 years. How would you describe it?
Thank you for the question. And I think that the mix of various proposals that we could see in all previous presentations, that would be the most comprehensive solution. An integral part of this 5-year plan or strategy for 5-year development through various action plans. Actually, I mentioned that, and I initiated this proposal related to the type of data and the manner of data collection. So research that don't have to be only qualitative. So population research, they need to be, they can be a bit different. So qualitative research based on some focus groups where we could assess some population groups, but in a targeted way. In addition to this research, of course, one of the key activities should be prevention, but prevention through institutions of the system, but at the same time prevention through all institutions that will, through multisectoral work, contribute to to prevention being even more intensive and focused in the existing systems. How to do it? We could see from previous presentations. So we need to implement new technologies, e-portals, counseling, okay, individual approach, but in addition to individual approach, we also need to work with work in the community through a global campaign that would not be limited to a certain short period of time, that would entail numerous intensive activities. So defining the framework of indicators, definitive partners, that would be somebody who will participate in obtaining these indicators. In addition to all of that, support, peer group supports, so from various population groups, as we could see today, and at the same time, inclusion of all other associations that can contribute, because then these activities will really be broader. It would come from the community and it could be implemented in the community in the most efficient way. Well, I was thinking about a brief answer, so I'll try. We need more people, experts, professionals, who will be working on this problem. We have wonderful experts, wonderful professionals, but right now, people who work on mental health, they are under huge pressure. We need to get relaxed so that we can think more clearly and we can continue working. But for that, we need to have more people. It takes more of us. We know the needs in the region. For example, Slovenia, they are much smaller than us, but they have 3 times more child psychiatrists than we have. So we need more experts. That would be my vision. And that could be achieved in 5 years. I mean, we have a lot of young people here in the room, and I'm sure some of them would really like to go into this profession, which is actually wonderful. Another thing, I would like this wonderful program that was developed and that was supported by Origin and UNICEF and our institution. I would like it to come to life in every city in Serbia. Okay, first, to be realistic, in cities and towns with population over 50,000. So to have teams for young people, I would like this to happen in the next 5 years, and I believe that this country could find the funds to implement things like that. This is not that expensive, you know, educate experts. This is not as costly as some other things that we are investing in. And third thing, and I think this is also really important, to find a way. I mean, we heard from Leah. I'm really thankful for her for saying this. We need to take better care of ourselves. We are forgetting that we should help each other. Our professions are very difficult. They have a lot of emotional toll. And if we don't help each other, I mean, UNICEF is helping us a lot. I'm really grateful to them. We've been cooperating for such a long time. But we need to be better to each other and to work better together. Thank you.
Thank you so much, Milica, for this very inspiring vision. And I think it's a very good, in fact, an excellent transition to my conclusion today. I would like to thank all of you, all of our panelists, for sharing your knowledge, your experiences. And I would like to conclude by saying that positive change starts with us. Positive change is possible, and positive change is already underway. Thank you very much. Hvala puno.
Thank you very much, Carol, for excellent moderation of this panel discussion. We know that mental health is related to daily routines, and good news is that it is lunchtime now. Lunch will be served when you exit on the left-hand side in the room Ivo Andrić B, and it will last until 2:30. Find somebody that you can talk to about work, be efficient, and come back refreshed. Thank you.
Dear colleagues and partners, guests, welcome back. Dear colleagues and partners, renowned guests, welcome back. We will continue with our agenda, and the next panel session would deal with the mental health and psychosocial support for children and youth. So I would give the floor to Bojana Jevtovic, UNICEF Serbia MP, MHPSS, for a focal point to initiate the discussion. Thank you, Elena, very much. Welcome back. Thank you very much for remaining with us. Somehow, after the first two panels, which were focused on vision, on systems, on policies, my honor is maybe the best one to speak about some specific examples at the local level and positive examples, how we can make differences at the local level with the already existing resources. And what is maybe the most important is how to get closer to youth and reach the services at the local level, because the local level is where the youth need to be provided with these services. I have quite a challenges task with a lot of panelists, meaning that we've got a lot of examples of good practice. So without further ado, I would kindly ask Ivan Antonijevic, Assistant Minister of Tourism and Youth. Thank you for coming here and for your support and for a huge invested effort to materialize a huge vision such as Youth Center. And for the beginning, what will give those youth center to the young people at the local, and you're advocating a lot for them, and you've allocated a lot of resources for that. It is my huge pleasure to greet you on behalf of my minister and line minister, Mr. Hossein Memic. And as we talked about some national plans and what we've done so far, then what we've planned so far, then who is assuming which role, we were in the darker part of the actually speakers, but it's very nice to speak from the standpoint of something who did something and who organized the community so as to provide services focused on young people. Youth spaces are places, as we've mentioned in the first panel, the safe places for the further development of the young people. The idea, I believe that Vukašin would speak how that idea, where that idea originated. But I'm going to tell you what is the role of the Youth Center and why it is important from the standpoint of coordination with the other local resources and the creation of the places where young people would have the opportunity to actually use those services that, despite the fact that they do exist at the local communities, are not something that they recognized as the services for them. They're either not informed or without possibilities to use them. Before we reflect upon the Youth Center, I would like to mention something that I forgot in the panel number one, which I was supposed to say, and that is that we as the ministry in the course of 2023 for the first time, and in this year for the second time, developed and supported the first national program focusing on preventing mental illnesses. This is the program that was originated by the CSOs and youth and organized in the associations. We've launched the competition in the amount of 28 million dinars and afterwards into 40 million dinars, and support the development of the mentioned services. And that actually we supported the different practitioners at the local level organize themselves, creating working group to talk among themselves and to say, as we do it at the local level, what they can do at the local level. So in 10 towns, we've got the situation that we've got the social workers, professors, psychologists, youth coordinators, youth workers, and that the mayors would chair those working groups. And that we really gave a specific importance, all of that, to be able. The aim was actually, we were doing that to create the services that would be accommodated by the youth center. When we were young, when we came back, when we used to come home, we would eat something and we would leave the rucksack at the yard. You fight with the friends, you even quarrel with them. Sometimes you're more successful, sometimes not. But those informal spaces were places where young people were acquiring a significant experiences. The youth center task is precisely to create locations for the safe development of young people not in a yard as what was when we were young, but where we would tailor the programs in the needs of the youngs and in line with the standards at the specific cases. We would focus on Opens and Novi Sad, but we wanted to tour town by town, municipality by municipality, and see that we can't do it without the support of the administration, that the local administration should select the place that would be dedicated to young people, and we as the ministry launched the competition jointly with the CSOs and the international partners and selected the towns that would be in the first round. As I mentioned, those were some. So what is the next week? We're going to open the first youth center in Somber. Congratulations. Thank you. And afterwards, Subotica is almost finished. In the coming week, we are going to open Subotica. Niš is huge investment. We had some changes that were conditioned and Novi Pazar, where we are creating the biggest center in the year 2. After gained experience, we increased the budget from 180 to 200 million dinars, and we've selected 8 municipalities. Youth center is not just a space. If we create a space, and there are the countries with such experience where they invested in the spaces, but those spaces never actually saw the light of the life. So our idea is to create capacities of the community, to recruit youth workers, to know who is a youth worker, who is the person guiding a young boy or girl through the upgrowing processes, to recruit youth workers, to kindly ask, sometimes to be a bit more serious in our roles, the local government to allocate the funds for the activities of those offices, and to have the local action plans develop their youth office and specific programs, meaning programs impacting on improving the life of young people. Someone mentioned in the first panel saying that young people are not living in the ministries, but they are living at the local communities. That is our approach in the ministry. Everything we do through intersectoral connection, connected with the others. We always think of the indicators that are important strategic documents, but to know what is going to be changed in the life of young people. If you ask me at a specific change occurring with the youth center, that is the youth spaces, because the center is not spaces, with UNICEF, we are working on standardization of those spaces. In smaller communities, they need a club. In some communities, those are centers which require different type of premises and equipment. And sometimes those are resource centers, which are bigger with the accommodation capacities and the bigger capacities for the organization of different kind of activities. I would go back, and with that I will conclude. What is the specific change occurring among young people who have the possibility to regularly visit a center? To the promotion through schools, and that's what we did with the national program. Promotion through schools, promotion at the places where young people spend their time. They are informed of the services provided in the centers. In our vision, this is the place known to the young people. They come, they hear, what do they have? They hear a workshop on empathy, then workshop on career development and the counseling. Then they attend those workshops, acquiring new skills, get to know new people, get connected, and further broaden their communities. in addition to the guarantees for young people, is the program that is very important because these services would be in a systemic fashion involved in the institution. And our task as a ministry is that those centers become places where we can reach out to young people. We're quite proud of that data, but it is fair to say that our researches show that there is a need to work more on gaining back the confidence of young people in institutions, that they often say that they are not informed, that they do not have a confidence in the institutions, and that we from institutions do need to work more on raising their confidence among young people. Actually, we need to present whatever we do to the young people, and there is a motto used, nothing about us without us. Actually, that the youth centers are the place where young people would further develop to get themselves participating in decision making, and that the services created should be created with the involvement of young people. And then, only then, they would have the ownership in those services. So, in addition to the services implying psychosocial support, counseling, and our focus in the youth center would be to bring back empathy among young people, activities that would make them think about each other, and what experts would better explain, that is the period where the peer community has the greater impact than their parents, than institutions. And our task is, through quality programs, enable young people to learn from each other, and not only to gain and acquire new knowledge, but to further develop their skills and support each other. Sometimes it implies triage. Sometimes youth workers are those who should be trained to see red flags and then instruct young person for professional assistance, and sometimes through those activities is guided properly by youth worker. They're quality enough to make young people aware of the situation they found themselves in and work on resolution of any problem related to mental health. And triage and support and referral, so where we see the potential for that are precisely in youth center. I believe that in addition to these 12, next year we will increase the budget and thereby increasing the number of spaces for youth, all in partnership with the local communities, CSOs, and representatives of all local institutions that attended the first panel here. Thank you very much.
Thank you very much. What I think, I mean, this message actually that we want to provide young people with free programs, not to leave them just in schools, for them to have some space where they can come together, protect themselves and develop. I think that this message is, this is the right path. This is something that will enable young people to achieve their full potentials. So thank you very much for this vision. And before we go to some concrete examples of how these youth centers could and should look like, we have two examples here. Before that, I would like to go back to another positive example. This is the example of Zrenjanin, where the next youth center will be open. In addition to that, Zrenjanin managed to, they found this magic formula for successful intersectoral cooperation. What we saw in the first panel at the national level, they managed to organize that at the local level. So last week, I was present at a spectacular event where 9 institutions at the local level signed the local protocol of cooperation for development of for support to early childhood development and to support to children and young people in the field of mental health. So first, congratulations. And thank you for that. And Mr. Simo Salapura, Mayor of the city of Zrenjanin, I would like to ask you, what is this magic formula? How did you manage to get such successful intersectoral cooperation? And even more importantly for me, maybe to send a message, what is the type of support support from the top management, from the mayor and from the local government, what support was crucial in this process? First of all, I would like to greet all the panelists. I would like to thank you, Bojan, and your organization for inviting me. And also I would like to thank all the institutions for Zrenjanin who allowed me, through their dedicated work, to be a panelist here today. I would briefly step out of this framework since we've all had lunch and now we're all a bit sleepy. So I would like to have a huge round of applause. But first of all, I would like to congratulate birthday to one of our panelists. I would like to wish him, so as a birthday gift, so instead of 8 minutes that Bojan allows us, we will give him at least 15 minutes of Vukašin. Happy birthday. Okay, so we, as a local government, we cannot interfere with the professional assessment of anything that these institutions are doing. But at the strategic level, at the level of the mandate of the local government, we can control and integrate and unify the resources through all these institutions. And in Zrenjanin, I think that this cooperation is not only related to this agreement. For many years we have been having this cooperation, and it's important to formalize this cooperation and to monitor it. Formalizing it meaning it goes into a strategic document, into the plan for the development of the city, and it goes into the programs of work of institutions that sign this agreement. At the territory of the city of Zrenjanin, we do have this. We do have the signed memorandum of cooperation. Of course, everything was done with the support of UNICEF. And what is very important is that we have people, specifically this person sitting next to me, she's dealing with this. But I don't want to forget all other people. A lot of other people are also working on this. And they are very dedicated, very committed. And I can see that they can really understand this topic. They understand that this is very important for our society. I mean, all of us understood that in the past 5 years, young people have come in a position where they are a bit lost. We had this unfortunate COVID pandemic where we had to socialize in online sessions. We didn't have direct contact. We had this unfortunate tragic incident in the school where young people lost their lives. Then we are coming to this life where we as parents, I mean, parenting is less and less working and dealing with your children. No, more and more people are chasing their jobs, chasing their careers. So we're not that committed to our children anymore. All of this is leading to the fact that now we have some omissions and gaps. And today, with this panel, with various other panels, we are trying to find a solution to the situation we are in. And I think that what we did is Zrenjanin, this is an indicator of the fact that we gave a new role to our institutions. We integrated the people into something nice. We are doing something for a joint benefit. This is the benefit, we're doing everything for the benefit of young people. This is our guide. Young people are our guiding star, and everything after us will remain in their hands, our city and everything else. But so we can never say we have full development without them. So in addition to the institutions that participated in all of this, these youth centers are an extremely important step towards progress and steps towards coming closer to young people. And I have to highlight that in addition to strategic documents that we had in Zrenjanin, through certain programs, we are funding specifically in the Center for Social Work. Olivera is the director there, so we are funding the program of the Family Center. There are programs like that, and it's really important to integrate things through resources, through multi-sectoral cooperation. We should hear people out, you know. Vera came to me 20 times about this issue, so we managed to push it through. It's very important to have good communication between us who are sitting in some chairs, who have some public offices, people who are managing the city, and institutions who are working on the ground and who are directly in contact with beneficiaries, with people who need the most help. So it's not a special magic formula, but I think that, yeah, Zrenjanin did it successfully.
Hvala.
Thank you very much. So we already announced her. So immediately I will give the floor to the director of the Center for Social Work in Zrenjanin, Olivera Lisica. She is somebody who takes care of maybe the most vulnerable group of population in Zrenjanin. She's somebody who is permanently developing services at the local level successfully. She is also the only licensed, they are also the only licensed safe house in Vojvodina, so the safe house in Zrenjanin. And in addition to all of that, she is a huge advocate of intersectoral cooperation. And thanks to her, the local protocol was signed. And maybe if you can briefly tell us what this local protocol, what will the local protocol bring to the city of Zrenjanin?
To the actually citizens of the town of Zrenjanin, to the children, young people, their parents, caretakers, foster families, family in the broader sense of that word. So that's how we started. What Mayor has mentioned, we have a tradition of the good multisectoral cooperation, and this is in our veins, so to say, to cooperate well among ourselves and to motivate each other and to assist each other. Of course, the situation is not ideal. The capacities in all institutions are limited, but in each and every mentioned institution, and the protocol was signed by the city administration, mayor on behalf of city of Zrenjanin, health center, preschool institution, center for the provision of social welfare, most, and social welfare center. So each and every institution has people who are motivated, understanding the importance. We all have a lot of work, maybe more than we can cope, but we still find the strength for some additional work. So that is something that I would like to say. Is as in Zrenjanin, I have to say, 6 years ago we did not have the counseling office for family and marriage, and now it exists with most, and it started and it was project-based, created, now institutional, available and free of charge to all of our citizens. So through this protocol, we've entered into the process of establishment of the minimum service package related to provision of the specialized psychological service, and that cooperation is embodied in the official form, and I believe that the support to the families in the broader sense we provide in an efficient and effective way because we formalized some things. Of course, this is a process, as I mentioned, this is not an evade, and we know that a lot of work is still ahead of us, but bearing in mind that the atmosphere in our town, in this area, at this level, is as it is, I believe that we will succeed in this endeavor as well. Thank you very much. Congratulations once again. And now I would congratulate you, not only because of the protocol, but you're going to be the next town with the youth center, but actually how those youth center look like in Serbia. One of the main partner in that process is Open's organization, and Vukašin, whose name we've already heard, executive director. And happy birthday, Vukašin. And instead of the gift, I would give him 9 minutes to speak instead of 7. And this is quite cordial from my side. And to kindly ask him to tell us how this vision is going to be materialized and what can youth expect in those centers.
First of all, thank you for the congratulations that you sent me and for the opportunity to talk about this conference. The partnership between OPES and UNICEF has been ongoing for years, and it is really fruitful. But what's important, and our starting point, it was actually this cooperation at the local level, cooperation between various institutions, organizations, the city, and the young people. Without this cooperation, without this understanding, without this joint objective that all of us worked on, it would have been much more difficult. For us in the youth center, we have the situation that our main partner is the city, that the city is giving us the basic funds for the program. Then through this program, we can cover the main things and activities. And then later, through fundraising, through cooperation with the national partners, through cooperation with the international partners, cooperation on writing various programs, we can double this budget or triple it. And then we can have as many programs and services for young people. So without this foundation, without this main part for functioning for our main work, it would have been much more difficult for us to be engaged in other projects, activities, and services that we can now expand. So the first and basic thing is to have this cooperation, to have the foundation from the local self-governments that are continuously providing support to the youth center and its programs. When this exists, when this will and desire exists, when this cooperation exists, it's easy to add some national, international programs and outside support. In Novi Sad, we could see that without the support from the national level, we cannot start big things, big processes. Even the youth center in Novi Sad, which was completed in 2021, it was built with the support from the national level. That's why this support from the Ministry of Tourism and Youth is very important. Support from the government of the Republic of Serbia provided to local government units who express their desire and interest, who express that they have knowledge, so they can maybe renovate, reconstruct, or build some new buildings where those programs activities can be organized. This is very important because local self-government units, they cannot allocate so much money for reconstruction of buildings and facilities. But when there is money from the national level for reconstruction, when there is some foundation from the local level, from programs and services, when there are organizations and institutions that are valuable, they're hard-working and work to improve things, then it's easy for us to get results and programs and services. Our youth center is visited by 15 to 20,000 people every year. When it comes to mental health programs, together with our partners to the Constellation of Support, we are providing more than 12,000 services for 4,000 young people. So this is all worth between 50 to 60 million dinars. So we found a way how to connect with institutions, organizations, service providers to see what is it that they need to eliminate the waiting lists, what are their needs to improve their work, how we can reach young people efficiently. And then to these resources that we manage to fundraise together, we can allocate the money where it is needed the most. It's simpler and easier for us to do it because we have this foundation from the city. We don't have to think about our basic needs. We can act as a coordinator and allocate the money where it is needed. If we had to think about every day about our survival, paying for electricity bills, etc., it would have been much difficult for us to help with others. That's why it's important to have this foundation, safe foundation, continuous foundation, so that we can work on things why we were actually established, things that are aligned with our mission. That's why when we advocate with local government units in partnership with the ministry, it's important to say it is important for local government units to give their contribution, because this contribution will return several times over. In 2019, when Novi Sad was the youth capital of Europe, we did a cost-benefit analysis that says for each dinar invested, 2.4 dinars returned to the economy of the city for the programs, for the youth programs. So investment into young people and programs for young people is not expense. This is an investment that returns several times over in this community that invests in young people. This is another example that we want to promote at the national level and in other cities. So this is not an expense. This is not. This is a far-reaching and long-term investment that will lead programs, bring programs and activities into your city, and it will offer options to young people to stay in places where they live. The third aspect to all of that is when we have this foundation, when we have main program, then together we can see how to exchange experiences, how to take some of the programs that work in Novi Sad and try them out in Vranje. If somebody works in Zrenjanin, we can try it in Subotica, and through this networking and exchange of knowledge and experience, we can be more efficient in programs and towards young people and their needs. And of course, all of that is based on studies and research of the needs of young people, because without this research, we don't do anything according to our wishes. We work based on their needs. That's how we create programs. And these are the standards that Ivana talked about. Backend is not that important, whether this is an association of citizens or an institution or a city administration. It doesn't matter what's the name of this place. It's important how programs are created, who is creating programs, who is implementing them, how young people are involved. And in this regard, we're respecting the ecology of every city, you know, whether they have a youth office or a citizen association or institution. So then let us see how we can have the same standards implementing programs in all youth centers. This is the task for us in the upcoming period, to take some of the programs that we realize work, we can multiply them with the support of various partners. Another thing that we managed to do in cooperation with UNICEF is that the large number of these youth centers, some projects that we piloted in Novi Sad, now we are implementing them in this city. So the mental health club will be also in Subotica, we will have it in Isha, Novi Pazar. So innovation club will also be expanded to other cities. So we're trying to find the things that we tried and piloted, but what we did in Novi Sad, we are selflessly sharing this with others. Because only when we share, only when we work together, can we multiply the results and take our modest resources to make visible results. And visible results means that young people will recognize it, young people will see benefits, and they will feel better in their society. I think this was less than 9 minutes, but thank you for that. Now, I gave you 9 only because it's your birthday. I think I managed to briefly answer your question. Yeah, you did. Thank you also for this drive that you have. This is important, you know, we want to send this message to all local government units. Because right now, young people are left to schools and social networks and to find some programs that they may have in their community. Some communities, they don't have them. And this struggle that is continuous, this means that we need to offer things to young people so that they can take care of their own health, so they can develop their skills, and so that they can properly, so they can be the main potentials in places where they live. We need to offer them high-quality programs which are not only school-based. And now, what this looks like in practice, there are fantastic examples in our region, even not that far away. So one of the maybe most successful and the most well-known to us youth center, most famous youth centers is in Ljubljana. We have General Manager Ksenia Perko with us today. Thank you very much for coming. And Ksenia, unlike other speakers, Ksenia does have a presentation because we wanted to illustrate what these youth centers look like and how they work, how they can work, and how they are providing support to young people.
Hello, it's Ksenia. I will speak in English. I prepare some presentation. Okay, because I would like to share with you the feelings, you know, not just words, but I want to inspire you maybe with the feeling how I see or how we are doing this youth work. I would like to present holistic approach, how we support young people and how we take care of mental well-being. That was the expression which was mentioned even before. And I really also agree that it's better to talk about mental well-being than mental health. This is not working, or?
Na sredini. In the middle, it's a huge middle. No?
Evo ga. Just to share that I'm really a long time in youth sector, working on the different levels, also in the international and also national, but I think that the real impact we can achieve on local level. Because this doesn't. Oh. Pa da, ali, dobro. Ovaj za tamo, a? Da, super. I would like to share also with you a little bit of context. I'm from Ljubljana, and the youth department of Ljubljana is there now for 30 years, isn't it? So, and we have strategic plan for 5 years, and the public institution from where I'm coming is there for 15 years. And we have 5 youth centers, district youth centers. We have mobile youth center, which we transform from old city bus with the participation of young people. And we have another community youth center, which we transform from also old bus, but it's not mobile because it was too old. So we put this old bus in one really not so poor, let's say poor district, because we would like to research what kind of impact has this kind of intervention, you know, to put something really strange, like you can imagine Viola old bus, which is like, you know, equipped as a community center. And I would like also to share that mostly we are financing from the municipality budget. So we are not worrying about, you know, the salaries or the cost for the space. And I agree with you that this is really important if you want to do long-term impact. Šta ovaj za napred? Dobro, evo. I also would like that we have this same picture how many young people is in Ljubljana. And also I would like to share some numbers of my organization. There is like 21 employees. This is for last year. It's like 12,000 hours of different activities. We had 5,000 different participants, and we work a lot with volunteers, and we had 40,000 of visitors. I also would like to share, you know, the numbers, how much this costs. As you can see, 26 euros for one visit, 84 euros for 1 hour of the program, and 290 euros for one activity. So you can imagine it's like more than 1 million euro of our budget, annual budget. And also, I would like to share how it's who are these employees. We have one coordinator of all youth workers, and we have 2 counselors. And this is really important. We decided that a few years ago, because we were thinking, you know, that we should support young people also in this social, mental level. And then we found out that it will not be possible, you know, with 2 persons to really deliver great support or support they need for like therapies or everything. So we decided that these counselors are mainly, they are supporting youth workers, but because the youth workers are crucial, because they have this relationship, they have this contact with young persons. We also have coordinators of different projects, and we have, okay, some administration. This is the definition of youth work. which I think is good, and it was developed through European initiative, Europe Goes Local. I don't know if you know this initiative. I don't know if the Serbia is the part of it, but I really recommend, because also in the European level, they found out, you know, that youth work and the really impact in the field working with youngsters is in the local level, is in their districts, it's in the neighborhood. It's nice, you know, that we have these programs and European and national and everything, but real work is happening in the field, and we should be there where the young people are. So besides that we have youth centers, we work a lot on the street. So we have quite strong street team of street youth worker. And also I would like to mention what is also I'm running out of time. I also would like to share that this problem with the staff, you know, it's not just about the money. We don't have much, and this is not Slovenia problem, it's not, it's European problem. We don't have teachers enough, and we don't have enough youth workers. That's also the problem. I will share just, you know, this picture with you because usually in Ljubljana or in Slovenia we have got, you know, the places which were like not so beautiful for other businesses, you know. So in the basements or small places in the buildings in different neighborhoods. So this is the illustration which is really important for us because we try to convince our decision makers that the youth needs the building in the middle in the city. And this is the palace, it's called palace really, and it's the palace where it's near the river, and it was used to used by family who had factory for sugar, so it's really palace, and it will be youth center. It's like 2,000 square meters, and we will have floor for well-being of young people, and some different, but I don't have any time left
Considering you travel from Ljubljana, so please, I will be so kind to provide additional 2 minutes to finish. So okay. I'm not that bad.
Yeah, I'm really sorry. I had my timer, but yeah, I'm talking too much, or I don't know. What I would like to share, you know, also that the program of this youth center we develop with young people and experts through different meetings with them. And when I was talking with the mayor and decision makers, you know, it was like they wanted to know how much, they wanted to know how many hours, what kind of activities, which kind of workshop. And as we are like, youth work is about the participation, it's not about the service. Youth work is to support young people to do what they want, what they wish. So it was really hard, you know, to explain what will be there. Except like, yeah, it will be place for community, it will be, I don't know, it will be different activities. But then I got this idea and I connect with one artist and we developed this illustration, and this illustration was crucial that they say yes. Because when they saw this, they said, oh, now we can feel it, wow, now we know what you're talking about, you know. So also we decided in ground floor we will have coffee shop and other drinks, and it was also, we decided that there will not be alcohol. And it was also, you know, the idea really strange for many people, and now they are proud. I just want to say that it's really important that youth workers who are really working in the field, that they find ways and words how to explain what is needed. That will be the last word.
Perfect, thank you.
Thank you very much. somehow we always have huge expectations from young people to know how to cope with pressures, to know exactly which faculty, which college to go to, how to find a job, how to get by, how to start their own families. But on this journey, we are not providing them with enough programs so that they can strengthen themselves and deal with all those stages and choices. So thank you very much. This was a very illustrative example of how from gentle starts, from a cafe, you went to other levels, and you are comprehensively supporting a young person. Finally, we always talk about participation, about empowering young people. We keep talking that we can't do anything without them. We cannot make our progress without them. But somehow, it's never clear enough why this is important and how to actually do this in practice. I mean, very often this is just, we organize one focus group discussion or a brief meeting, maybe just a questionnaire sometimes. But how can we really empower young people and include them? Because everything that we are doing this precisely for them. So Mr. Victor Hugo will help me with this. Thank you very much. And just a reflection maybe on this component from you.
Thank you very much. I like to pretend that I'm a young person still. So maybe we can start with, I think we've been sitting down for too long without moving our body. Maybe we can start with a bit of a roll of the shoulder, if you can join me. Yes. So this is one of the things that young people do, is that they have a way of lighting up and making it a bit fun. And it might sound very casual, but I think it goes beyond saying that the way that we're currently engaging young people, not just in Serbia, across the world, in so many places that I've been to, is through consultations. And one of my biggest challenges for everyone today who's been part of the program, the amazing program that's been shared so far, is that you should go beyond consultations. You need to think about how young people can take leadership, how they can be actually part of the program itself and not just beneficiaries to the programs. Because we say nothing about us without us a lot, and I've heard it quite a lot, and it's great. But I say nothing about us without all of us being part of the solution and the action in itself. So I'm gonna touch on 4 different points when it comes to the importance of involving young people. The first thing is relevance. Now, young people have a better understanding of their own situations than others that are not them. I'm 34, and when I speak to my niece who's 12, I feel like I'm 70. And it's not been that long that I was 12, I think, comparatively. And what that means is that with the current, with the evolution that we're seeing in the world, with, constantly evolving needs, constantly evolving emotions and expressions of those emotions, we find that young people actually, they get different every year. And that means that the solutions that you create have to keep on adapting to those constant changes in their needs, in the expression of emotions, in the slangs that they use that we don't know what they're saying. I mean, a young person can be discussing with another young person and you will not understand what they're saying. They can be saying the same English words or the same words that you know, but they mean completely something different. Now, before you can create a solution that actually caters to the needs of the young people, it needs to fit into the languages that they speak, the ways that they communicate, the ways that they express emotions, the ways that they accept expressions of emotions. So when you involve young people, you improve the quality of your programs, you improve the relevance of your programs, and you improve the sustainability of your programs. And the second is reach. We were conducting a research a couple of years back, and we were asking young people questions about how we can reach the usually unreachable youth. And one of the things they said is, within our networks, we all know each other in some way. If you can get to me, then I can get to someone who you couldn't reach. So when you involve young people, they act as the bridges to other young people. And they are best placed to do that as well, because a young person is more likely to listen to another young person. I feel like you all know this. In school, it's much more difficult for a young person to speak to a teacher about a problem that's going on, but they can speak to their friends and their peers. And the third point is capacity. And this is something that we've seen happen in so many different places where there's been emergencies, in Syria and Ukraine, in Turkey. Young people are usually the first responders. There's a lot of them. They're very enthusiastic. They're very, happy and lucky, happy-go-lucky folks. They're usually involved as first responders in responses that require capacity. But the problem is that we're not constantly preparing them. We're not providing them the right tools that they can be much more actively involved the way that they could be. So if you have young people who are well capacitated, and I give an example, there was a Red Cross program in Iceland a couple of years back before COVID. And when COVID hit, it was the young people who were trained in psychology first aid that were supporting the response for mental health within the country. And the same thing in Kenya as well. When there was a riot due to a protest, it was the young people who were trained through a program that were once providing support to those protesters and young people who were dealing with difficulties. So when you build capacity of young people to participate and lead, they actually take the action into their own hands when it's needed. And the last part is that youth participation in youth leadership benefits young people themselves. So I always tell people that I think of youth participation as a mental health intervention. I think it's one of the most simple and easy to design mental health interventions, because when you involve a young person in something that concerns them, you're building agency, you're building self-esteem, you're building confidence, you're building soft skills that they find useful for their future life and future living. So I'm going to stop there for the importance, and I will go to the principles that I think people can apply in involving young people. And the first one that comes to mind is being intentional. I think in so many ways, so many organizations and so many institutions don't have any existing policies for engaging young people. We think of it as a very straightforward thing. We get them in the same room, we have conversations, have a dance, and then we go. There needs to be a structure attached to it. There needs to be policies about safeguarding guidelines, how to make sure that they feel safe, how to make sure that they feel like they can express themselves without being talked down on, how to make sure that they understand that whatever they say is not just used as it's not a checklist for the people listening to them, but it's something that actually feeds into the decisions that end up happening. So being intentional and being realistic about collaborating with young people is very important. One of the tools, examples I'm going to mention is a tool that we developed more recently that we're piloting in Colombia and Jordan and Southern Africa. It's called the Readiness for Adolescent and Youth Engagement Scale. So this scale helps organizations assess themselves for how ready they are to actually work with young people. So we ask questions like, do you have an existing youth engagement policy? Do you have a youth focal point? Are they trained in how to manage and facilitate youth engagement? And other questions. And the scale is set up in such a way that it mandates that you involve senior leadership in the assessment, so that if any decision and any action plan is taken, they are involved in that and they can they can say, well, we can prioritize these top 3. And what we're trying to do is to make it look like, the first time you go through the scale, it becomes a baseline for you, and you can select 3 action points that you can realistically go with. And then the next year or the next 6 months, you can go through the scale again and say, okay, I'm done with these 3. I'm going to take on 2 more action points. So that way you're building on existing progress and improvements in how you're engaging young people. And the second point to look at is to adapt to young people's realities. I think that we always assume that because they're young people, they always have time. But what I've come to learn in my work with young people is that they actually do not have time. There's so many things that they are involved in. There's school, and school is not the most fun thing. There's some of them working as well. Some have, extracurricular involvement. We make the assumption that they have time. They don't have time. So adapting your programs or your work to their own realities is very important. Being flexible enough to fit in their own needs is very important. So making an assumption that because they're young people that, if we say this is the time, that they all have to make it there, it's not how it works in real life. And another thing I was going to mention for this was to actively seek out young people where they actually most enjoy to be. So one of the examples I'm going to give is, in Nigeria, we're designing a program we call the Conversation Cafe. And the Conversation Cafe was something that ideally was meant to be done in halls like this. But when we consulted young people, when we spoke to young people about them taking ownership of it and actually delivering it and facilitating it, They told us, we would love to have the cafes in an actual cafe. I mean, you named it Conversation Cafe. Why not we have it in a cafe or have it, close to the beach or somewhere fun? So they actually took their yoga mats and sat down and facilitated conversations about mental health. And I mentioned this example because I've had conversations about stigma. In Nigeria, stigma is a massive issue, just like it is here. And I can tell you that in over 8 years of that cafe going on, there's been so much increase in how young people feel more confident talking about their own mental health, because it's been made a bit more fun to talk about. But it's not just fun to talk about, it's conversations that happen facilitated by them, led by them in ways that appeal to them. And if you go into a conversation cafe, most times you're considered as someone who is cool. So you have to adapt to young people's realities. They like things being fun and fancy and cool. Make it work that way. The third thing is equality and partnership. I think in most ways, whenever you have youth in front of advocates, we tend to think of a young person's perspective that's just focused on their own lived experience. Just tell us how it is being a young person. Tell us about your own lived experience of mental health conditions. But young people have the expertise themselves of beyond their lived experience of actually influencing and designing mental health programs by themselves. So when I was 22, I started my own foundation, and it was the only nonprofit foundation at the time that focused on social media. And because of that, over 8 years, became the biggest mental health organization in the country. Now, I had psychiatrists and established professors before me who started nonprofit foundations, but they didn't go far enough because, at the time, it was just really focused on, let's do seminars and get it over with. Let's teach you about, all the different kinds of mental health conditions. But when you have young people involved as equal partners, as a young person who involved other young people, it was easier for us to think about where is the best place to meet young people, what are the best programs that we can develop with them that serve their needs. So think of young people as partners, and the qualification of youth does not deprive them of the expertise that they do actually have. And the last thing for me, the last thing is inclusivity and diversity. And that goes back to the point of nothing about us without all of us. I think most times when we involve young people, we involve those that are well-spoken, those that can, very charismatic, they can speak clearly enough. But that excludes those young people who do not have the platform to gain those skills. Excludes young people who are typically marginalized, young people dealing with disabilities and those with lived experience of mental health conditions. So we need to constantly think about including young people beyond the typical and the usual ones that we always involve, because it's comfortable. Because when you involve young people living with disabilities, you have to make sure that you have access ramps. When you involve young people with lived experience of mental health conditions, you have to make sure you have a psychologist on call. Obviously, it makes it more difficult, but I promise it's something that is always worth it. And it's something that we should do anyway. And the last point on this is in agency and ownership and influence. And I think it's important that when we involve young people, that we involve them through the entire stage of the program. So from designing the program to implementing it to evaluating it for its impact, and then communicating the feedback of the impact of young people's involvement to them. So that's something that usually doesn't happen. So we usually just get young people involved after we've designed a program. So they join advisory groups. When they join advisory groups, we have conversations with them once every month or twice every month, and that's it. And sometimes we don't communicate how their input has actually influenced the program that they have been called on to influence. And that actually, it just disempowers young people than empowers them. So sometimes I try to, and I think that's the last thing I'm going to leave today, is to challenge you to go beyond consultations. I always think of youth consultations as an excuse not to have young people lead programs. So I would say, maybe that's a bit drastic on my part, but I would say go beyond consultations, start to involve more young people to be more participatory in every stage of the program itself, and then think about how to hand over that program to them to lead as a goal for your program. Yeah, so I'm going to stop there, and I'm very happy to be invited here today. Thanks.
Thank you. Thank you. Thank you so much. And we have 10 minutes more for one quick question. I would just want to, I mean, most of people here who is dedicated working with the young people. I will switch in Serbian. Srpski, da, izvinjavam se. Većina ljudi
Most of the people, most of us here today are people actually who have been actively and continuously trying to improve the lives of small people in their communities. You know how hard it is and how many challenges we face with on that journey. Of course, I would like to go stepwards. A young person in a small town who is at this point of time is sharing the news, which are from the political perspective, which are quite challenging. War in Ukraine, war in Israel. We've got quite an accelerated evolution of jobs. So you need to find the proper profession and find your own proper way. You need to overbridge some fears Corona left behind. So I believe that there are a lot of things put upon them and how to make good choices. And we always forget what an important role we all play in their lives. Because tomorrow we can pass by an adult and that person could definitely recognize us because we've contributed to a certain sense to the quality or the development of that key developmental stage of that young person. So thank you very much for being involved in this work. And since we've closed the last panel, how do we care about our own health, about the health of the people working with you, your fellow colleagues, bearing in mind that I've got a panel of leaders at the leading positions. Maybe I can ask them, how should we care about service providers, how to properly support them so they can be equipped and give the proper response at each given moment. Thank you very much. It is quite a difficult question, but we've got 10 minutes time. Yesterday, actually, we had the opportunity to speak with Gabriela, among other things, about the development of the mental health programs, action plan, and the similar. And that question popped out, actually, how to support those who are providing assistance. Actually, I would repeat, are the youngest sector in terms of the development of those who still need to find their place among other sectors. So in that regard, it is very important to take care of this issue, that the people dealing with the youth work, youth activism, when you're not recognized, then you're overwhelmed and overburdened, not to find those people in the burning out syndrome, to make them constant fresh, because they're always facing with a lot of problems. And as Vokashin mentioned, CSOs would like to do something, a youth office would like to do, then they fight for those problems, and they're overburdened with an unstable financial plan. They're constantly racing in a chase of funds. And often people working with youth are not full-time employees. Those are the young people with the lowest salaries in the public sector at the local level. And therefore, from the standpoint of an institution dealing and fighting for their rights, we do recognize that. And it is very important to provide them the support, to focus them, to support each other. But it is our responsibility that burden put upon that unstable financial position, financial instability, moment of being in balance with the other sectors dealing with young people is our responsibility. We do recognize, and we try through the improvement of the conditions at the local level they work in, they are supported. We do recognize the importance of these topics, and we stand ready that we would be working on the professionalization of youth work, recognition of such a work. We would also focus on this segment, how to support them. Those are the generations that are coming. That we don't have just the young workers, but those are the experts in the field. So in addition, they need to follow the generation, as we had the chance to hear from the colleagues. We do not understand. We need to adjust to them. So when developing and designing this program, we will be aware of all of these things. I, as a social worker by profession, I know the concepts, how the assist the supporter, support provider, and we as the institution will take care about that. Thank you very much. I haven't heard the applause. Not for me, but for my colleague. I would simply focus on this topic. The trust is critical. We are lacking the trust of young people into institutions. If I, as a mayor, am an institution and hardly accessible to young people and youth workers, then we are having a problem. I recognize that by default, when someone is putting on a suit, sitting in a good car, well, we don't know him any longer. He is hard to be accessible. He is sitting in an armchair in a closed office. What we, my collaborators at the local, recognize at the local level is that we've introduced an institution, a dialogue with the mayor. So every month I am having a dialogue with a student, with the high school student. We have a coffee and starting talking about the potable water investments. We're opening the cards, talking on an equal basis. And at that point of time, the initiative is brought about, their questions that are specifically the topic that we talk about. But when we lower it at the level of the young center, and when I pull all Zrenjaninac from Vukašin who are now working in Novi Sad, there was even when I visited Opens, 3 people from my town work, and when we pull them back to Zrenjanin, that strengthened them in the capacity, then we would, because I believe really that the people at a leading office should go down and open themselves to their community, and that they, through their office, give the importance to the young people. We talk about not leaving them simply to the schools, but to somehow work with them through the youth center. But I believe both schools and youth centers are very important. In Zrenjanin, we have one expansion of the school communities. So they, through their practical work, can generate some funds, can contribute to their local community, and thereby use the time in a quality fashion and to feel useful. Starting from the agricultural school, we've got the 4 school communities with the chefs, with the waiters and the others. I believe that this is going to be a quite pilot model that would be replicated next year. So there are huge capacities in school, and through that statutory provision that is not used, and those are students' communities. Thank you very much. How it is in the most difficult sector? Well, how to assist to the service providers. So we can simply speak from the standpoint of the leader in the Center for Social Work. A mayor has already mentioned that the Center for Social Work, we've got the Programmatic Activity Center for Family, and I would go back to the story, to the previous question. In that family center, we are providing support to family, starting from the early intervention, parenthood, and the mental health of young people. In that family center, support is provided by young people, young colleagues who are educated, holders of license, and who are using their free time. They are working outside their working hours to be able to work with the families, because we cannot do it in our working hours. How I observe the support to those people is to be respected and to be awarded. I mean, to respect their knowledge and to make that knowledge not only financially awarded, but respected in all possible senses. Thank you very much. How does it look like in youth center? I believe that a short overview, I believe it's going to be short. What is challenging, particularly in Novi Sad with the quite developed IT sector, young people, when observing their financial awards for the job that they could work, they would rarely select to be youth workers or to work in youth centers. So we are trying to give them some other benefits. In Opens, we've got the 7 working hours for colleagues who are working in some other sectors. They actually would, if they work 8 hours per day, they are going to get either allowances to the salary or some days. We've got the flexible working hour, and we can work over the weekend. So if someone work the weekend, those hours working that they work in the weekend, if you work 4 hours during the weekend, then you can take 4 hours during the week. We've got the HR who is constantly talking with all of our employees, developing personal development plan and the possibility of additional education, all the possibilities, services that are offered are also provided to our employees. At the monthly level, we are trying to have the activities to improve the teamwork, to travel together, to do the things differently from the way that they do it in the business sector, specifically knowing that we cannot offer the competitive salary such as IT industry, but to compensate in some other way to make a pleasant atmosphere, space, an informal setting, an informal working hours, and in such a fashion we are attaining everything that we planned. The new program that we're trying to introduce is Opens Nanny for our colleagues with children at the point of time when they are having challenges, when their children are sick, that we can step in and help them, because then they can dedicate the time knowing that someone is taking care of their children, particularly if they are not having the grandpa actually service. So we are trying to listen to our employees and to, in a different, innovative fashion, respond to the challenges we're faced with. And de facto, one of the things we would like to do is to increase the economic status of all of our employees.
I believe as a leader that I should be a role model for my co-workers, and they should be a role model for the young people. So I'm doing each morning the Resilience Leadership Program, which contains jogging, body exercise, and meditation. And really important is that I finish all this with the question, what is the purpose of my day today? So that I stay in my focus, and then I can keep my energy and also mental well-being like this.
Oh, thank you. Hvala.
Yeah.
And Victor, you have as well 1 minute.
1 minute. Oh man, feels like it's not enough.
How you protect your mental health? Kako ti brineš o svom mentalnom zdravlju?
Yeah, so I think that for just like, you know, for this topic, for so many things, for schools, for young people in exams, and even anyone involved in the workplace, there's so many already existing interventions that, you know, within the workplace, you know, where they have access to psychologists, or you have access to like some practices that you can do, or you bring a mental health worker to come and have a conversation. I think they're all well and great. But we still have the same problem still happening, which means that we need to do things differently. For most young people in schools, and I use that as an example, when you have access to psychologists or people providing support for you, that doesn't reduce the stress that you still have because you have just too much to do in school. So we are always focused on, you know, rather than preventing, we are focused on treating, which is the same thing that applies to the workplace. So what I would say is what we've been trying to develop for the past 2 years is that one of the biggest reasons why we have too small people doing too much is because of the lack of existing capacity. And one of the ways that we're trying to tackle that is to develop the capacity of young people to choose this as a career option for them by developing their knowledge, getting them in placements within local community-based organizations, and developing a portfolio for them to think of this as, you know, develop entry-level capacity and competencies to be able to apply for jobs and choose this as a career option so that we can have more people interested in working in this area, and that we were tackling the true cause, which is that people are really overworked.
Hvala.
Thank you. Thank you very much to all the panelists. I would like to thank all of you. Take care of yourselves so that you can properly take care of young people. We will have a coffee break, 15 minutes. If I can kindly ask you to come back at 4:05 so that we can listen to 4 more fantastic presentations from our guests. Thank you.
Wow, nije lako biti ovde.
Wow, it's not easy to be here under these lights, and I believe it's not easy to be over there as well after the entire day. And really thank you for sticking with us and for not deciding to change the channel. I think that this is a good opportunity today, at the end of the day, to really get closer, those of us who are really resolved to stay here until the end. And I can already invite you to start thinking about questions that you would like to ask. I think that now, in the end, at the end of the day, we'll have the opportunity to have a discussion, and for you actually to tell something to us. I learned in this line of work that it is extremely important to be open to new things, and that it is extremely important to change ourselves. And I am extremely pleased that today we have with us my colleagues for a long number of years now, Olga and Alexandra, who work at the Center for Interactive Pedagogy. We used to have various roles during our long professional lives. And for today's panel, our colleague Tanja Rankovic suggested that they come out. Unfortunately, she's sick, she couldn't come today, but she knows how good SIP is on the ground, how they are working with school and preschool teachers, how what a credible partner they are. We also have our colleague Anna Kakstrom with us today. She's coming from the National Institute of Mental Health in Prague, in Czech Republic. And I can see and hear that she also has some new professional roles now. The reason why we invited her is because she's really a champion. She is and was a champion among her colleagues in trying out a program, testing it, collecting data, and persevering in that until she finds a good balance, something that will make a real change, something that is proven through research. So congratulations on that, and thank you very much, Anna, for traveling to Belgrade for okay, it's a brief presentation, but a good opportunity to connect and to learn something from you. We also have Radovan with us, who is only 20 years old, if you may allow me to be open and to say your age. But he's young, but he's very mature and experienced. Radovan is one of the young champions who is supporting other young people. I believe that a large number of you, I think, decided early on their line of work. Now I can reflect on my beginnings, but okay, this is not the topic of our discussion. But I do know that it is important for young people to hear other young people, to hear right messages. You already heard this today during our discussion, I'm sure you know that. How that was done, what was the level of success, what were the challenges, Radovan will tell us all of that. And it is my huge honor to also have with us Dr. Marija Mitković-Vončina, who did something that is incredibly difficult. She packaged a training program within what we call the minimum service package for young people. She did a magical thing. She actually helped make sure that professionals from various sectors, doctors, psychologists, pedagogues, employees in social protection, all of them now found themselves in the same rooms in different cities, and they had to sit through this maybe a little bit of discomfort where you have to erase your professional roles, and next step is to actually make a bigger difference, to have a greater focus in your work with young people. So thank you all for being with us today. Where do we start now? I mean, everything is really important here. Maybe start with the pioneering work. Maybe continue where Dr. Milica Pejović-Milančević stopped today, when she said that the inspiration for our minimum service package actually came from Australia. And over the years, this was changed and adapted to Serbia. So, Maria, you have the floor. Please, if you can tell us something more about that. Thank you very much for the wonderful introduction. I'm very grateful to all of you who are still with us here, although it's been a long day, long and fulfilled day. Well, if we can just have my presentation. If I can just ask for the clicker, the pointer for slides, where is it? Okay, maybe if we can ask the technicians to change our slides. Ah, here it is. I didn't see it. Yeah. A lot of light in my eyes. It's not easy sitting here on the stage. We've heard several times about the needs that brought all of this, but let us recall, we should always have it in mind that 1/2 of all mental problems happens by the age of 14 and 3/4 happen by the age of 24. And the assessment is still that only 30% of young people who have problems with mental health, only 30% receive timely support. And it can be 10 years from the first symptoms until getting support. So obviously we have challenges in several directions in Serbia. This is probably related with the need for a higher number of experts. This was mentioned several times. We have a need to work on competencies of professionals and to work on a functional multi-sectoral and cross-sectoral relationship. To respond to all these needs, I can feel free to say that we made the first step where nobody stepped ever before. That's why we have this photo. We have psychosocial support to young people, thanks to incredible enthusiasm, continuous effort of UNICEF to enable young people to have the best possible options. So this project started everything. So the Institute for Mental Health, in cooperation with organization Origin, maybe the most relevant organization for young people in the world, with support from other ministries and relevant bodies. So we started this in Serbia. We see my colleagues. I'm really grateful to them. They are the team of our institute. So the essence of this project, and hopefully this is something that will keep on living. This is what all of us want. This is our vision. This is something that connects us. So we have this minimum package of young services for psychosocial support. What is the minimum package of services? This is a collection of various interventions, evidence-based interventions, which young people need to receive. Not only that they can receive it. I mean, mental health has become a bit of a luxury, you know, not right, but a luxury. Every person has the right to get this set of interventions when they have some problems with their mental health. Those are usually young people who have some early signs of mental health problems. And in the early stage, you can identify it and take some actions so that we can prevent further development of these problems. And this package can be beneficial to young people with some other problems in terms of maybe more developed problems, the most developed problems, some of the people who are already receiving specialized support, but all of them need this psychosocial support in their natural environments, in places where they actually live. As Gabriel said, they live in schools and in other, they're in contact with other environments. So the services are intended to all of them. And who is providing these services? We had this question several times. Does this mean that we have to be certified psychotherapists? No, it does not mean that. These services are provided by experts for mental health. This is a broad spectrum of related professions for mental health that Stasha already mentioned. Those are experts who went training for the minimum package of services and who have the dedication, who are sensitized for the developmental needs of young people. Minimum package of services. Let us see the structure of the training dedicated to this. So we need to have some prior knowledge that we need in order to provide the systems. Then psychosocial interventions, and very importantly, for everything to survive, mechanisms for intersectoral cooperation. In order for somebody to be able to provide interventions, they need to have enough knowledge, basic knowledge necessary for that, for development of mental health, for early warning signs. Then what's really important is that we need to build relationships with young people to establish joint work with them, and young people need to actively participate in creating how they are, the way they are supported. It's important to know how to assess difficulties and how to assess the psychosocial functioning in order to set objectives and to individualize the support plan. When it comes to psychosocial interventions, They actually cover several key domains of a functioning of a young person. They help with skills for a person to be able to return to functional life. Functional recovery is actually the main target of these interventions. So these are interventions to regulate difficult emotions and daily activities. These are lifestyle interventions that teach young people how they can relax, how they can release tension, how they can activate themselves when they are in this vicious cycle of helplessness, behavioral activation, how they can establish control over their physical activity, sleep, nutrition, which are important preconditions for a complete well-being and healthy functioning. Then we have basic interventions based on cognitive and behavioral principles. Those are the most basic principles that lead to changes of emotions through the changes of opinions and behaviors. We have several of the most important here that are addressed in the training. There are lifestyle interventions used for problem-solving skills, because young people often have objective problems, not only their personal interpretations of problems, but they have some really challenging things around them. They get tangled, they don't know how to get out of that, and they need to take big problems and dissolve them into several smaller steps. So we have communication skills, assertive training, how to communicate to defend their rights without attacking the rights of other people. Very importantly, particularly important for us after the May events last year, this is trauma-informed care. When it comes to these interventions, we're not talking about any specialized treatments for traumatic disorders that require specialized training. This is about an entire system of care for a young person that takes into account the needs of the person who had a traumatic experience. This is the trauma-informed care, trauma-informed support, and psychological first aid and psychological recovery. This is also important. This was important after my events. This can be used in the most natural environments, such as school. Then recognizing the signs of trauma that requires referral to specialized treatments. We should know what to recognize and how to refer them. Particular focus here is on protection of young people from abuse and neglect, with a focus on protocol for each system. And of course, very importantly, and today it was mentioned, self-care of experts, vicarious trauma, burnout, compassion, fatigue, and the ways to keep themselves functional. Where you have young people, you have parents, families. So family-based interventions is something that is very important, how to involve parents, what are the different levels of support. And another thing that is important is which steps to use when we encounter young people with some conditions of specific risks, such as uncontrolled anger and violence, suicide and self-harm, psychotic episodes, and other problems requiring urgent referral to specialized services. And finally, sometimes we forget this, but this is equally important as the things in the beginning. So things that come after the intervention, how to help young people to return to their functional life, to family, to school. This also requires very important support in their natural environment. And we now are coming to the intersectoral cooperation. In order for all these elements that I mentioned, so they can stick together, be functional, it's necessary for them to have a framework. Intersectoral cooperation is the framework for that. It involves several principles. One principle is the step-by-step support. Milica mentioned this today. So we provide for some milder problems and soft interventions. We have soft interventions in some natural environments where young people live every day. And then for those with more intensive problems, they can be referred to the most specialized services. So this slide shows up proposed step-by-step support. So the first step is the pedagogical and psychological service at the school, counseling center, social welfare institution, and then later we assess whether there's a need for urgent hospitalization, for other types of psychiatric services. We have a problem here because at the primary level we don't have child psychiatrists, we don't even have enough psychiatrists in general. This is just food for thought. But it is important to recognize that the path of adolescence to the system needs to be clear, structured, it needs to involve, and this is our proposal, it needs to involve a team for support to adolescents. It includes experts from various sectors who follow this young person and help them with the transition from service to service. And what's particularly important, at local level, we need to know who those people are, who is in this network, so that this can really come to life in real life. We are very grateful to many stakeholders involved in this training for the participation and implementation of services from the minimum package. And I would like to particularly highlight the importance of supervision. This is what maybe separates this training from other trainings. Because, you know, after a nice, interesting theoretical part, actually, we have this encounter with reality where professionals try to implement their knowledge, but this supervision was very precious for them during this implementation period. So just briefly, I can say that about pilot evaluation is showing promising effects. We have the increase of the level of functionality after 3 months of interventions, and that mentors did a very good assessment about the efficiency of intervention and other aspects of importance for the intervention. Young people received improved functionality and less discomfort, free help available, help at school, health center, social protection, less stigmatization, building skills that are important for the entire life. This is not resolving only current problems. This is investment for their entire functional life, individual help, and own involvement in the improvement process. There were some challenges as well, such as barrier to the first request for help, time and space for interventions. Everybody observed this. Somehow, you know, experts have a problem to get by, to find where is the place that is safe enough. Can they fit it in with their other obligations? And the biggest fear, will the interventions be continued? When it comes to experts, we also saw clear benefits here. Improvement in their own awareness and competency, improvements of their knowledge, high satisfaction with the training and with the mentoring. Great importance of supervision was recognized by many experts, and they realized that these interventions really had effects. What's important to say is that this minimum package of services allows knowledge, skills, and framework for something that experts are already doing in their work. It just gives them a framework, gives them a structure, protecting not only young people who are receiving evidence-based interventions, but it's also protecting experts who feel safer in their skin and in their roles. Challenges were also there for them, barriers of obtaining parental consent. Parents knew in the beginning they didn't have enough trust, then time and space for interventions, too few experts. This is a challenge to do all of this, and also the fear will be able to be continuously available for these services. In line with this, how to proceed? Hopefully we will have a large number of municipalities. Hopefully we will cover entire Serbia. Actually, this is the only way to implement this model. We are preparing some publications that will be useful as guides for this, a publication that will explain how to implement this, and also the campaign that informs the population about these important aspects. And at the very end, I would just like to say that, once again, this is a message. There needs to be more of us, and we need to be on the same side. As some wise people said, civilization of one society is not reflected in the finances that the society has. It is reflected in the way how it cares for the vulnerable populations. Thank you.
Thank you very much. Well, yes, this is beyond empathy. This is compassion and action. A lot of experts are cherishing and readiness to cooperate. There is another controversy regarding the activation of peers as supporters. Some adults are quite worried. Isn't it a huge role given to a peer? And then again, we still believe, and had a chance to hear a few moments ago, that this is a proper way, and we've tried. Radovan will share with us one program titled I Support My Friends. And you, in your handout, in your materials, have a QR code. Boana is showing. Thank you, Boana. You can show it, yes. And that's where the publications translated into Serbian language are, developed by UNICEF, World Health Organization, and Save the Children, which are a tool for you if you'd like to widen the program. We are looking forward to hearing from Radovan. Thank you. For the beginning, why peer education? Well, in line with the researches, and of UNICEF, it has been proven that the young people would address more first to the peers than to the expert. And according to my personal experience and my friends that underwent the same education, we in a way confirmed ourselves through our practice the mentioned fact. Peer education is actually providing the education to young people We are not there as their psychologists. We are there just as a kind of a support and the bridge between young people and the psychologists. We are not a replacement. We are not replacing psychologists, but the person who could tell them that there is always a help and they can always address someone, and to inform them about services available in their town, but they are unaware of what. For example, in my city, a lot of, for instance, organizations are providing free support to young people. When it comes to the training for the educators, it lasted 4 days. The age of participants was 16 to 24, and there were 20 of us. In the course of that training sessions, we learned how to control our own emotions while speaking with the young person, to put the boundaries, and how we can get closer to our peers in a more professional way. As I've already mentioned, this is how the training session evolved. In the course of the training sessions, we had the practical exercises, public speaking skills, and other activities, everything that we needed to learn. We've also were actually involved in get to know your community, in terms that we are giving the Novi Sad map to our peers and whether they know where they can find psychological assistance. And it turned out that they were completely unaware of that. And in the end, we've got the evaluation and we were handed out certificate and we shared our opinion on the project. So the key information, I've already mentioned them. We've learned how to recognize difficulties with our peers, to develop the active listening skills, to set our boundaries, and to learn a bit more how to gain trust relationship and the confidence relationship between us and the young people that is addressing us for help. Well, peer education process was in the following way. We sent to schools, our schools and the other schools where we wanted to organize the training sessions, and mostly they accepted the offer, and then we agreed with professors to, instead of their matter subject, we dedicated that class for this kind of education. We also put on the information board constellation of support, sazvežđe podrške, to see the numbers and to call experts in case they need the help. Once a month, we've got the meetings where we shared our impressions about different schools we visited, and we've tried to resolve some of the problems that we encountered that we encountered on the journey, and we try to resolve them with our supervisors. We had this kind of education in 4 towns. We are planning to expand it to 2 more. 76 peer educators, and I am one of them. And we are focusing on the topical issues for young people. I personally had a situation with my friend where I initiated the story about suicide because my peers wanted to talk about that, and we had quite viral reactions. volcanic reactions. Peer education has improved. A dialogue regarding the mental health in schools, which can be confirmed by the fact that the psychologist of that school approached me and told me that she is now working more than usual and that the students are approaching her more than before. Young people are informed where they can address, and I believe that I covered it all. Well, it seems to me that you've mentioned that at a certain point of time it was not an easy task to do. You've talked about the quite difficult topics, about the topics the adult believe better to leave them behind. And we know that the researchers show that it's not bad to talk about suicide. It's better to talk about it. And I will remind you all that have been with us ever since the development of the program, that for the first time we had a young lawyer, our young colleague Milica, who is now the user of the wheelchair, who attempted a suicide, and because she was quite a successful young girl that managed to cope with everything. She was smiling constantly, but at a certain point of time that happened, that she was overwhelmed with something. And now she dedicated her life to talk with young people how important it is to talk about these difficult topics. And I cordially commend you for your bravery to, among the practitioners, among so difficult topics, cope and get connected with your friends. Please, now applause for this young person.
Dobro.
Okay, now we are making a sharp turn in terms of expertise, capacities, but not in terms of courage and dedication in the work on the problems of mental health and well-being. I would kindly like to ask Anna Kagstrom, our colleague from the National Institute of Mental Health from Prague, to address us. Please, Anna, the floor is yours.
Don't need translation. Hello, my name is Anna Kagstrom. I'm very grateful to be here today, and I just want to say, as the first, I guess, foreign experience, it's incredibly inspiring, this country context and all the work that's being done. So yeah, gold standard definitely for the region, and many learned things being taken back to my context. So having said that, I lead Child and Adolescent Mental Health Research Program in the Department of Public Mental Health at the National Institute of Mental Health in Czech Republic, and the work I'll be doing today also falls under our work as a WHO collaborating center for public mental health research and service development within the region of Central and Eastern Europe. There we go. So a large portion of our work, it's quite multidisciplinary. We have researchers, educators, youth, and implementers on our team. But a large portion of our work is built around working in schools to develop mental health literacy. So I wanted to just start with what is mental health literacy? What do I mean by that? It has 4 components. The first is understanding how to obtain and maintain positive mental health, so this mental well-being that has been spoken about throughout the day, understanding mental disorders and their treatment, decreasing stigma, and then increasing help-seeking efficacy. We started with some developmental considerations because school-age children are quite broad, right? You have 5 to 18-ish-year-olds. A program for a 18-year-old is very different conceptually than a child. So if you're interested, we've done some research work on theorizing developmentally appropriate content for mental health literacy school programs, which is in a review here, translated appropriately for you. I won't be going in depth in that today, but we clustered these 3 groups, 5 to 9, 10 to 14, and then 15 to 18-year-olds, and our target group of the work that I'll be presenting today is that middle group. The rationale being that 50% of mental illnesses present before age 14, and there's quite a few programs for high schoolers. There's quite a bit of SEL and preventative work with younger kids, but in that range of high risk help seeking, there's really not much that has to do with mental health in schools. So our approach is implementation science oriented. We use theory of change, which I've seen a couple of today, so it sounds like that's familiar here, which is wonderful. To first develop, then implement, then evaluate, and we're now in the scaling up phase of a curriculum for grade 6 and 7, age 11 to 13. So this is theory of change framework. It's iterative. You go from development to feasibility piloting to evaluation and implementation and back and forth as you learn new things through the data that you're collecting. So we've been working on this since 2018, I believe. So this is quite a process, I would say. These are synthesized stages, the first being formative development, second piloting, and third evaluation, which we just completed. In the formative work, we hired a youth platform. They're not included in the research numbers here because they're part of our team. We have 5 14 to 18-year-olds who basically have been part of this project since the very beginning. They set the needs, they set the priorities, they work on intervention development, consulting on all the materials that we put out, branding, the name of the program, etc. So I'm not going to go over the youth participation component to it today, but just know that all of this work also includes those 5 youth. I will also say they're paid. I think this is something that is really important that we don't talk about a lot with participation and engagement of youth. Volunteerism only gets you so far and can easily lead to tokenism. Youth are busy. They don't have all the time in the world. They are experts. They are stakeholders. They should be treated as such. So if I can just assert that a bit. This is our theory of change map. It's been translated. So I'm not going to go into the details of it today, but this, again, is probably the 5th iteration that we developed. So all of those stakeholder consultations, the 64 in developing the intervention that was on the past slide, led to then adaptations of the intervention. And we worked with mainly teachers, youth, and our piloting trainers in that was like our core content group, and researchers. Balancing the theory and evidence base and then the real world anecdotal input from stakeholders is, I would say, a struggle. From my perspective, you really want the youth to be able to feel ownership in the final product, but at the same time, we know what works and what doesn't, according to research. So there's a certain amount of conversation and dialogue that has to happen throughout that process to make sure that not only the youth are engaged stakeholders, but that they're up to speed and have appropriate knowledge and competencies within the field to be able to make informed decisions for their peers and for their target group. So that's also part of the workload that falls into this theory of change map. The whole process is published. We're trying to generate some process-oriented papers as well. And if you're interested in reading more about it, I've just provided a QR code there because we don't have time to go into the details today. But ultimately, what is our final intervention? We have a training of trainer models. There's essentially, I'm wondering if it makes sense. Sorry. Yeah, I'm going to skip to this slide. It's a 18-lesson plan curriculum, which is meant to be delivered over the school year. Each lesson is 45 minutes. The theories and topics that are within the curriculum come straight out of social-emotional learning, mental health literacy, psychosocial school-based public universal interventions. But like I said, we really took into mind the youth priorities, and peer support was one. And some topics related to suicide and self-harm were another. So we made sure to have mental health first aid as its own component, even though we consider this a prevention promotion curriculum. Mental health is the first topic, and then emotional literacy, relationships, communication, and the fourth, like I said, which came out of the youth requests and not demands, but priorities, being mental health first aid. Just for the sake of what does this actually look like in practice, these are some examples of the lessons. We have one is, what is mental health? I know we've been discussing, or I've heard discussed a lot today, we shouldn't be talking about mental health, or maybe mental well-being is a better term. In our curriculum, we teach the mental health compass, which basically asserts that if you have a mental health diagnosis, or if you don't, we're all still striving for this continuum of mental well-being. So it takes the stigma of, are you clinically diagnosed or not, out of the work we're doing with peers, acknowledges that there can be clinical issues within reality. But at the end of the day, we're all people struggling. Some people need treatments to get to mental well-being, and some people don't. I mean, clinical treatments. So that's our approach to kind of dealing with that stigma and issue, and we find this actually to be quite useful with the teachers as well. In our teacher training, it's as much of a service to the teachers as it is to the students, so we feel like it also kind of meets the need of caring for carers as well. All of our programs, or all of our lessons follow a very similar structure. We have like key takeaways that the students are meant to journal. Those come from evidence-based skills and competencies from that review that I mentioned in the beginning, but also self-discovered takeaways. This is another thing that came from the teacher and youth feedback, which was, okay, we learned a lot that wasn't included in the final outcomes of the program. How can we acknowledge that and kind of take it forward? So we added into the journal, what is your self-discovery? And then it becomes kind of a tool, or like a self-designed tool for how to take care of my mental health long-term. Again, a lot of the feedback from youth has led to more products. We want to know more about self-harm. We want to know more about what's happening in puberty with our bodies. So we develop, in collaboration and co-design with the youth, different printables, posters, etc., materials on these topics with the team. And again, hopefully the time is okay. We're in the middle, we just finished a randomized controlled trial on this intervention in over 60 schools. We've actually started scaling up, and part of our RCT is an impact evaluation, which is under publication now, but also a fidelity assessment, which I think is quite important as well for this topic, because if we know something works, that's great, but how it works and why it works and being able to adapt it and scale it to different contexts is essential. And so these are some of the extracted barriers and facilitators from the fidelity assessment that we're analyzing right now that I thought might be useful for this conference. So the first being pedagogical issues in schools, if we're working in the field of mental health, will be an issue. If there are behavioral issues within the classroom and those aren't sorted in terms of teachers having the skills and resources to be able to deal with them, there's no amount of mental health training that will help. They need pedagogical skills and support at a school-wide level. A second one that I haven't heard a lot in the field is children often know a lot more than the adults in their world about some of these topics, especially as it pertains to them, and I don't think we acknowledge that enough in the field, and even to the youth that we're working with, that we're all trying to figure this out, we're supporting you, but it's not always going to work. So that's one of the key things that we really try to talk about in our teacher training is it's okay to not be the expert in everything and to work with youth to improve their lives. Stigma, I've heard loads today, I won't go into that in depth. Risk and safeguarding is obviously a need. And then we've had some barriers with data collection and such. Facilitators, integrated teacher and coordinator in direct contact with teachers has been an important component of our teacher training. We've found that teachers need just as much as support in implementation as they do just in theoretical learning. So we've combined the role of coordinator and trainer in all of our curriculum programs, which means that the teachers come to a training, they get trained by someone, and then that person is their supporter in implementation. They're not separate. That we learned through piloting because of many issues we had, but this is pretty essential to my perceived success of the fidelity. Obviously, these core process components are key facilitators. Safe place, I've heard a lot today. That's not a unique thread. Another facilitator is that I think teachers are quite motivated. They see the need, they see the problems in the school. So if we can tap into that and make a service that benefits them as well as their students, it feels like a quite primed platform for this work. Which leads me on to make sure that it's perceived as a benefit to the teachers as well as the students. Ultimately, we're all here to improve youth well-being, but the carers are key to that. So that's all I have for today. And again, I want to thank you for having me here today.
Thank you, Anna. You will have the opportunity to pose questions. And really, throughout the whole day, my impression is that words are very important and that a single word, when spoken out, could have a different meanings. And thank you very much for reminding us that the right expertise in the hands of those that are living and experiencing the things, and that we need to treat them equally. Actually, to be aware that the different positions, leading, assisting, are reiterating and structuring the play of the power, which is very important, but should be avoided in these kind of situations, because we are all together. Thank you very much. And let's see how the situation is in Serbia. In our school, I don't know who would take the lead. Alexandra, Olga, please. Good afternoon. The good thing is that we are the last in a row, so thank you, Stasha, for wonderful words about the center and our joint cooperation, because the Center for Interactive Pedagogy is an organization that last month had the 26th anniversary. So we've been intensively working on improving the well-being of children and the family for 26 years, primarily working with the educational institution. How many of you have ever heard about the CIP Center? Wow, nice, 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 perfect. For those who know, just a small reminder and focusing what are the new things we are working on, and for those who never heard about us, an inspiration and motivation to visit our webpage and to see what kind of resources do we have and how we are providing support to the educational institution, but also the families, because we have a lot of materials dedicated to parents. Today's schools are facing, because the focus is on schools, so we would focus on schools, not on preschool institutions. So the educational institutions are facing with this difficult challenges, how to improve the quality and to make that education relevant and to create children and develop the competences that are necessary for lifelong learning, and not simply to skip from the content and the goal. To deal with competences. So the quality of education is something that is the primarily challenge. The atmosphere in the school is another challenge. Chasing the curricula, a lot of things are left behind, and that is primarily that educational level and the support to the personal development of each and every student. Extracurricular activities are the perfect resources that schools have, which sometimes is not used properly. And the peer support, Radovan talk, how peers are important. So we really want to put the focus on the importance of the support by peers. Important. So when we observe all of these challenges, and we've got much more than just those that we've listed so far for this conference, what are the possibilities and what do we have as an organization and how we support? First of all, we've got the training sessions and the mentorship support provided to the schools, because the training sessions by themselves, they are good but not sufficient. And we need to have the continuous support to schools that they really, what they got through trainings, they materialize in their work. Then we've developed a lot of resources, and thank for this opportunity to share those resources with all of you present here. Some of the resources, not all of. them. Another thing that is very important and we keep on insisting on is horizontal learning and networking of institutions, of schools, preschool institutions into the learning communities. And we are also supporting the school projects so that the schools develop their own projects and implement them and take the autonomy in their own hand and improve their work in line with that. So now I would go back to what we've mentioned. We have a lot of projects, and we've implemented a lot of projects in the past 26th year, primarily with UNICEF, and we've initiated and finalized a lot of things together. So we are cooperating with the Ministry of Education. And what you can see now on the slide is the manual for schools, how the school can support the upbringing role and how to strengthen it, how to be the support to both children and families. And another thing that is important, this is not a classical guide or manual. Not only that it is giving a theoretical input, but it is posing the question and thoughts and clear guidelines, what they can change, what they can do differently. And what we would like to announce that is that very soon, I believe in next 2 weeks, a video training would be launched that is monitoring these guidelines with the experience of teachers and practitioners who managed to live that educational and upbringing role in their schools. And this is something that is that will soon to be light. Those are the things that we've developed with UNICEF for both teachers and parents. This is an open resource. It is on the National Educational Portal and the training session that's posted on the webpage. On the Education Passport, there is a series of material for teachers, parents, and separate set for parents. So this is a wealthy that is providing schools a tool to work with parents. That is something that is new. We believe that could be a significant support to schools in planning the overall work and the support to personal development of the children. This is the self-evaluation application available to all schools, which help them assess the quality in all 6 quality spheres, but to base their planning to data that they will get through the use of software. We developed the software with the Children's Foundation. These are the brochures for parents. In the year they appeared and they were available to preschool institutions, which was 2 years ago. We had 4,000 visits and downloading of the brochures. They are dedicated to parents. And now I'll give the floor to Olga. Thank you. Good afternoon to everybody. You would like to deprive me of applause? My apologies. We're going to get the joint applause.
Now I have the honor to talk about social-emotional learning. This is a topic we always like to go back to. We always like to talk about it and work on this topic. This is not a new topic. Back, Aristotle said that educating mind without educating heart is not education at all. And in 1970s, this topic has became current due to this cognitivistic approach. So social-emotional skills are related to understanding emotions, managing stress, problem solving, responsible decision making. But there are many other skills that also make our lives nicer. So kindness, or giving and receiving compliments, etc. This is a lifelong process. We learn these skills from our birth and we learn them through the entire life. There was a study that is done on 200 programs dealing with social-emotional learning, and they show that there are multiple benefits. For children, this means lowered level of stress, so better opportunities for learning. We know that we cannot learn when we are under stress. And better academic achievements. Then teachers using social-emotional learning, they take care of improving their own competences in this area. They rarely have this burnout syndrome, they have better contact with their colleagues and students. Parents also have benefits because by implementing social-emotional learning projects, this creates better connection, better participation with parents. Parents see school as a community they belong to, and the effects are reflected on the community as well, through more satisfied citizens, through better physical and mental health, and proactivity, where all of us think about how to make everything good and better for us. What's important to say is that social emotional learning is not intervention, this is a preventive program. If we do it with all children, with all students in a school, this means having integration of various activities which improve social and emotional competences of both children and adults. But at the same time, this creates the climate and the environment where we support each other, where we respect each other, and we create an environment that is safe and secure. Another thing that might be important to say is that it is important that social emotional learning is implemented both in practice and in policies of schools, and this ensures sustainability. SIP Center started working on social emotional learning through development. First, we started with preschoolers in cooperation with the ministry and UNICEF. The project as environment as a safe and secure environment for learning. This was inspirational, and this was a way for us to create various resources. And currently we have ongoing project practitioners of community for social emotional learning in the functional development of personality of students. This is in a way a response to the current needs of schools to improve their upbringing function. I'll mention some resources that exist. It's important to mention trainings, modular training on the list of programs of public interest. This is something that will be a permanent resource, and this is actually about how to improve your own social emotional competences and how to support development of social emotional competences of children. 2 video trainings here intended to preschool teachers. On one hand, it covers the main ideas of social emotional learning, but also gives practical advice on how to implement them in practice. And handbooks which also support this entire story, one for preschoolers, and the other one is being prepared for school-age children, and a brochure for parents that actually introduces this to parents so they can learn how to support their children to develop these important life skills. Thank you very much, Olga. Thank you very much, Olga. I would like to thank all of you who presented how you reached through systemic ways and through service providers. Hopefully you reached a large number of young people and adolescents who have a need for support. I'm sure that there's a lot of work ahead of us. Today we heard about 2,000, 10,000, 50,000, but we know that there's more than 1 million young people in our country. We know that a lot of big tasks ahead of us. Believe it or not, I decided to give up my power for some 10 minutes. A power actually to speak to you in my microphone. I will give you the power to use the microphone. So please, if you have any questions for our colleagues, we can use this time for maybe some responses, to share some personal stories, to ask for advice, whatever you think is important.
Good afternoon. I'll be the icebreaker. First of all, it was not clear to me from the first presentation for the minimum service package. It is not clearly defined whether pediatrician as the professionals could actually the first doctors the children see could be involved in the provision of that package of services. Thank you for this quite an essential question. Of course, yes. I believe that that is the question that we need to pose to you. Is a pediatrician with the 50 checkups a day could cope with it? So this is a challenge, and I believe that this is the in line with the message that yes, we need to be in greater number, but the pediatrician is quite important for a young person. That is someone who is constantly in contact with the young person, and young persons actually frequent pediatricians, and this is like a cornerstone. But then again, there's a question with the overwhelmed situation of the service. But yes, colleagues from different sectors, including the advisory of the pediatricians, and we do hope that the pediatricians would be covered through the further circle of trainings. But then again, may I pose the question, what do you think about that? How do you see it? Is it feasible and doable in your practice? Counseling for young people as the developmental council are based on the additional pediatrician staff. And unfortunately, the pediatricians, we are actually having the shortage of psychologists, and we cannot base the future on something that is lacking. It is not sustainable. So the minimum knowledge of the pediatricians who are specialists of developmental, depending on their specialization. So it's not a question whether, but it should be based on the training of pediatricians. I believe that it's questionable to speak whether they know and whether they are ready. Thank you very much. I believe that we faced with a lot of colleagues rich in enthusiasm from different counseling services. We are completely aware that there are limitations in their time. So I completely agree with you that yes, this is the training session that should be present, but our appeal, the training is there, but we need to increase the number of experts of all those working in those counseling centers and in these sectors. Thank you very much.
Do we have any other questions, any comments from the point of view of peer educators, from the point of view of maybe young people who need additional support? Any other comment? Mira?
Znamo da nam treba kadar.
I know that we need people, I know we need counseling offices, I know we need to continue with the advocacy. Just as a comment, I would really like to thank SIP for what is the absolute trend worldwide. So what you showed us, I think we should, I mean, everybody knows that even when I'm critical, I have good intentions. So I have to say that this entire aspect, I think we need to strive towards supporting children to develop their healthy components so that they don't stumble at the first crisis encountered. I think children are not to blame. You know, all of us here are adults. We are to blame for the current environment, you know, that the children live in. We are to blame for the values that are currently existing. So we have to rectify things. And I think maybe we're a bit late now, but we have to involve the preschool level, school level. We need to we know where children are living and moving. I think this is the right recipe. This is where we need to go. Thank you very much.
Hvala, Miri.
Thank you, Miro. Thank you for good messages. I don't think we have any other comments. So once again, a huge round of applause for our panelists. We learned a lot from you. And now I think I should give the microphone to Elena.
Dragi gosti.
Dear guests, as we are coming to the end of today's conference, we would like to express huge gratitude for your participation and active work for creating better services intended for mental health of young people. Before we officially close the conference, I would like us to give the floor once again to Stasha and Carol so that they can remind us of some key recommendations that came from today's conference. Thank you once again. Thank you, Carol. We will really try, by the end of this conference, we'll have several more steps, and in our future work we will always try to work together. That's why it's very important for me that I will do this together with Carol. She's a supporting supervisor. She is very important for the mental health of us in our office. So together we will send some encouraging messages about our work. So last year, we provided a forum for young people to work in a nice group, to work even before adults to prepare the recommendations. And I would like to remind you about everything they told us. They told us, don't leave us for later. And I think this is a very precious and don't forget me. They also told us that they're expecting their teachers to teach them how to take care of themselves. They are looking at adults, they're expecting support. They want to know where those safe places are for them. They want to know where the professionals are who want to talk to them. They are empathic. They want additional support for their friends who are receiving services from the social protection system. They want to be involved because they are experts for issues that concern them. They want systems of peer support, both online and offline, in real life. We shouldn't forget this good reminder that came from the colleague Danilo a couple of years ago, when he was explaining that the life is more difficult for young people now because they constantly need to take care of two realities. There's the real life, physical reality, and there's reality of their online personas. So they need support on both fronts, in virtual life and in real life. Young people also asked us to help them to train their parents, to train the media, and to train other young people about how to talk about these issues without any judgment. We heard today that ministers have taken steps, and really those steps are not small steps. Those are some big steps, big investments. A lot of work was done on these topics. Our role is to be communicators and to kindly ask young people who are here with us today. I will definitely help you with that. So please convey this message to your peers, to your friends, because we need to have this constant feedback, interrupted feedback. Today we agreed that we will try out using a new language that is less stigmatizing. We will try to talk about constant well-being. We will see if we will manage to be so skillful like Anna and her colleagues to make a good concept. Since we are moving on, we are continuing more motivated than ever. So the commitments that we have undertaken now, that the ministries have undertaken, we have to continue with some of those things. We have to continue with being dedicated. We will try to bridge the gap in terms of data. We need to know what we measure. We need to know that when we do our next study, you know, we have to contribute together to making results better. Right now, we have numerous activities in our action plan with ministries, but we want them to be integrated. And we want to make sure that together we will have better results for young children. This is what we are striving for together. We will continue advocating for support, for funding to be increased, to increase human capacities, etc. We will continue working on campaigns. We will try to reduce the stigma. And we will continue investing in reliable communicators of our message. I think you are one of them, and thank you very much for that. So we need teachers who know more. We want to invest in youth workers. We want to work with people who are driving their communities to make sure that all of us are actually providing this first aid when it comes to mental health. And we want to support parents on this journey as well. Carol, please.
Thank you, Sasha. I also think that today marked a very strong milestone. We heard about the renewed commitment of the 6 ministries on the Memorandum of Understanding they signed 1 year ago, and on the action plan costed to $1 million that we will implement in the coming year. I believe it sets a very strong foundation for us to work on even more strategic and long-term investments in the coming year. What would be this long-term investment? I think, Stasha, you described very well some of those. And I'm just going to recap the big pillars of those which are related to the institutional commitment of UNICEF, together with all partners, stakeholders, and the 6 ministries, to continue to invest and engage for a brighter future. I think we have a very strong commitment from the government of Serbia, and with this very strong commitment, which already translated into a very strong interministerial coordination, we will continue to strive to strengthen the intersectoral collaboration at all levels for the implementation of the action plan, but also beyond. And in this regard, I would like to share our gratitude to the Ministry of Health and to the 6 ministries for their continuous leadership. I think it's a very strong milestone. What does it mean? It means increased and strategic financial investment to enable the establishment of sustainable community-based mental health services tailored to children, adolescents, and their caregivers. It's not going to happen in one day, but we have seen already since the past year the immense progress made. And I believe that we are very well positioned today to continue to maintain this momentum. It means that we will continue to strengthen our efforts to reach the most vulnerable children and young people and make sure that they have access to a careful, respectful, empathic support when they need it the most. It means, as Tasha mentioned, that we will redouble our efforts to fight stigma and to promote help-seeking behaviors. And the most important, it means that we will make sure that our entire action is guided by the voice of children, adolescents, and professionals. And I would like to thank all the young people and volunteers who are with us today and who have helped us to shape during the entire year this event. So in this journey, you will be able to count on UNICEF as a trustworthy partner. UNICEF will continue to provide a reliable support to the government and to all actors to make sure that together we can ensure a brighter future, happier future for all children and adolescents of the beautiful country of Serbia. On behalf of UNICEF, I would like to extend my most sincere thanks to all of you who came from all the corners of Serbia, and especially I would like to thank you for the 365 days you spend every year to remain committed to ensure that children have a safe and respectful environment. I would like to thank all of you, and I would like to set a round of applause to all of you for your unwavering dedication to the well-being of children and young people of Serbia. Zajedno, I love this word. Zajedno, together, we can commit today to deliver on our promise. Vala puno.
Can I invite the team on the stage?
Now, I would like you to know that actually the two of us are not working in a silos. You had the chance to see the colleagues, and I would like to use this opportunity to call all of our colleagues, UNICEF colleagues, to join us at the stage. Marina, Bojana, Marco, Valentina, please come and join us. Let the audience see our faces. And volunteers, all of you, please join the stage. Please, all volunteers, all young people, come to the stage. A lot of, they have a serious duties. Please, Valentina, help me position them. A lot of us, not at the stage, prepared that were involved in the preparation of this conference. Thank you very much for everything. Thank you for your dedication. Now, I would like to invite our colleague Mačak, who took photos of us to advise us how to create a group photo with our audience so that we have a proof that we were in a large number, so that we know next time when we will organize the conference next year. Mačak. Audience should come to the stage. So please join us at the stage. Yes, come to the stage. Let's take a photo.
Aha. Može i da se sedi, može i da se stoji.
You can sit, you can be seated. You can be at your feet.
Tanja Zanjac. Ostali Jelena Zajganović, nisam ni videla da je tu.
I haven't seen Jelena Zajganović. Verice, Tanja, Viktor, Hugo.
Gago Koruga.
Gago Koruga, please, Olga, join us.
Samo da vidimo. Ček, molim vas samo za malo pažnje da nas mače.
I kindly ask you for your attention. Those who cannot be seen, put your hands in between the shoulders of those in front of you.
Very
Hvala svima.
Thank you all.